Hello, everyone. Good evening. And we have the director, we have quorum, so let's get started. I'd like to call the Ottawa-Carleton District School Board meeting of January 11th, 2022 Committee of the Whole to order and acknowledge that the meeting is taking place on unceded Algonquin territories. I would like to thank the Algonquin nations for hosting this meeting on their land. And with that, I would like to call for a mover to approve of the agenda. Thank you very much, Trustee Blackburn. And are there any changes to the agenda? And seeing no changes, I'd like to call the question on the agenda. All those in favor of adopting the agenda? And opposed? And thank you very much. That passes. So then moving on in our agenda, briefing from the chair of the board, I would like to call upon Chair Scott to provide her briefing.
Mr. Chair, are we doing this before the delegations?
So in my script, I had you first, but actually on the e-scribe, it does have the delegations first. So let's go with the delegations first, okay? Sounds good. So we're gonna move on to delegations and come back to the briefings later. So we have 5 delegations this evening, and we have also a written delegation. And I would just like to remind the delegations that we do have a little amount of time. And so the amount of time that you have does vary, and that if you fail to, if you are getting towards or past the end of your time, I'll remind you. And if you continue, then unfortunately I'll have to mute you and move on. As well, there's a certain level of decorum that this public delegation is expected, and I'm going to be just monitoring those. And if that level of, if there's things happen that are against our bylaws, I'm going to also have to mute you. So with that, I'd like to move on to our first delegate, who is Adrian Lesage. And are you with us this evening, Adrian?
Hi, I am.
Oh, thank you. And you have 4 minutes, Adrian.
Is there any way that I can go second? I really was not planning to go first. That was not the original plan.
Certainly, we can accommodate you, no problem.
Thank you.
So we're moving then on to Kwadwo Kyra Menteng. Are you with us this evening? Can we admit him? Is he in the waiting room?
He should be in now.
Okay. Are you with us this evening, Mr. Kyra Menteng?
Yes, just trying to set up the video or the everything here.
There you
Hello,
go, and we can
everybody.
hear you and we can see you.
You
Thank
can
you
hear
very
me
much,
okay,
and
thank
you have 4 minutes for your delegation, please go ahead, followed by possibly 3 questions of clarification by the trustees. So.
Amazing. Well, thank you very much for allowing me to speak today. And I'm mostly coming as a father of 3 young boys, 2 of which are attend school. One next year, I come as a researcher and a physician. I work in the intensive care unit in NRC. And what drove me to come speak to you guys today is, you know, I just really, I think sometimes policy needs to reflect the risk, especially when it comes to our kids. And me being there from the beginning, so I was there for our very first ICU patients, COVID ICU patients that came through our doors. And as you can imagine, it was very intimidating, scary. And so I saw firsthand the damage that COVID has done. But I've also seen the firsthand damage the policies have done, the non-COVID related illnesses. Like in terms of, what we've learned, we learned, for example, the risk factors for getting sick from COVID: age, vaccine status, your diabetes, high blood pressure. And then you also see luckily that kids have been, for the most part, are ultra low risk of getting sick from COVID, which has been a godsend, in terms of how that has come through. And just to give a perspective, I'm not sure if you guys got the documentation, but kids are about 3 kids per million that get infected are at risk of passing. And so, to put it in perspective, driving your kids to soccer practice or to swim lessons is a much higher risk than dying from COVID. And so, I guess I just wanted to express how some of the policies and for example, school closures have truly impacted, have had some unintended consequences. When we look at some of the economic impacts, like we started a charity called Bridges Over Barriers through the Education Foundation, and one of the reasons was how much people were struggling with the school closures, with the economic burden, and when families were having to choose between diapers and feeding their family. We've seen the devastating impacts it's had on the mental health. When we sit down with the social workers and they tell us, that like this is the biggest burden right now, is how it's really impacting their mental health of our youth. And this, unfortunately, has been disproportionately affecting BIPOC communities. And so one of the things that I'm here to say is, when it comes to our decisions, our policies, our mandates, for example, like there's a lot of talk about mandates when it comes to vaccination. Remember, BIPOC communities have been hardest hit. There's a lot of vaccine hesitancy, and our people have suffered a lot through the mistrust in the medical system, and I can't wholeheartedly sit here when a young BIPOC kid whose parents decided that vaccination is not in their best interest is now not going to have access to school, despite having all this already being hard hit with COVID regulations and also the mandate. So I hope this is helpful. I'm running out of time. I'm so sorry. The one thing I would also say is that things have transitioned much since Omicron has come into play. Like the idea that our kids can avoid COVID at all costs is not a reality. And the thing that I just want to
Mr.
reinforce,
Mintang, I'd like to ask you to wrap it up as you're over your time.
for sure. The last thing I'll say is that Omicron has changed the landscape of COVID. Unfortunately, we're all going to be exposed and likely to be infected with Omicron, and I think our policies have to reflect that. And what the best way to protect ourselves as individuals is vaccinations. And I just think that also needs to be a kind of a theme when it comes to safety amongst our teachers and those providing education.
Okay, thank you very much. And are there any questions for Mr. Mintang? And seeing none, I'd like to thank you for your delegation. And you can certainly watch the rest of the meeting as it happens on YouTube. So thank you very much. And we'll
Thank you so
move
much.
to Adrian Lesage. Are you there, Adrian?
Yeah, I'm here.
Okay, so you have 4 minutes for your delegation, Ms. Lesage, followed by up to 3 questions of clarification from trustees. So go ahead.
Okay. So good evening, everyone. Happy New Year, first of all. And thank you for allowing me to speak at this meeting tonight. So I'm going to try to get through this as quickly as I can, hopefully in the 4 minutes. I'm a resident of Ottawa. Been born and raised here. I'm a mother of 2 children, and I'm also a former elementary school teacher in Ottawa. I'm speaking here tonight on behalf of the children who have not and still do not have a voice in all of the decisions being made for them over the past 2 years. As much as we like to say and think children are resilient and adaptable, there is a limit to that resilience. Children's hospitals have been reporting a crisis unfolding across the province when it comes to children's mental health, social development, and general well-being. This can no longer be ignored or chalked up to an unfortunate but necessary sacrifice we must make. As I'm certain most of here are aware, there's been astronomical increase in the amount of children and youth who have started to self-harm and or developing eating disorders as a method of coping with their anxiety, stress, and uncertainty that they've been forced to live with, and to which there seemed to be no off-ramp. It seems no matter what we do, nor how many months or years go by, our children are still being expected to bear the brunt of many of these restrictions, mandates, on and off again school closures, missing out on important celebrations and milestones, canceled recreational activities, and worst of all, social isolation from peers and family members that was forced upon them by lockdowns and social gathering limits. In speaking with friends and colleagues, as well as other members of the community, many parents feel this is no longer justified, nor is it sustainable, especially given the low level of risk posed to this age group by the current situation. With now just above 90% of our city's 12 and up population fully vaccinated, there's really little to no justification for this continued trajectory. If we do not start leading the way and advocating for changes in our response and the applicable mandates imposed on students, I fear they will never be allowed to go back to a sense of normalcy. Some questions to consider: how many boosters will be recommended for children? Are they needed for that age group? Will the children need to stay masked in perpetuity regardless of the vaccination? When will we decide it is safe to stop counting every positive case in the school and notifying and sending home close contacts? We know the virus is now becoming endemic and will unfortunately be with us for the long haul, as with seasonal coronaviruses such as influenza and the common cold. You need to ask ourselves, what will be the final benchmark for allowing our kids to go back to normal learning? What is the end goal, knowing that complete eradication is not possible? My youngest child is now 10 years old. She's been out of in-person school and schooled online since March of 2020. Although our students have gone back a few times over the last 21 months, we chose not to send her to in-person learning because she suffers from anxiety and panic attacks and would have not fared well in the environment that has been created. Mandatory all-day masking, requirement to social distance from friends, canceled favorite sports, social clubs, and gym class would have been detrimental to her well-being and would have exacerbated her symptoms. So we made the difficult decision to keep her home and watch over her, as we believed at that time this to be a temporary setback and the lesser of two harms. We never thought we would still be here 2 years later. My daughter has expressed fear of even having to sneeze or cough in a classroom, fear of being sent for uncomfortable PCR testing and subsequently forced into 10-day isolation at home. As adults, we know how to
Excuse me,
cope
Mrs.
with
Lesage, can I ask you to wrap up as you have got to the end of your time, please?
All right, I will wrap up. Okay, so in closing, I guess I ask the board make any future decisions about mandates, restrictions, while taking into account latest medical information regarding children and youth, new emerging data, and doing risk-benefit analysis, so we can all work together for a better path forward for the students and a permanent return to normalcy.
Thank you very much, Ms. Lesage. And do we have any questions for Ms. Lesage? Ms. Lesage? And seeing none, I'd like to thank you for your delegation, and certainly can watch the rest of the meeting, how it unfolds on YouTube. So thank you very much. And we're moving on in our delegations to number 3, Jamie Janes, Are you with us today, Jamie?
Hi there, I certainly am.
Okay, thank you very much. You have 4 minutes for your delegation and followed by possibly 3 questions of clarifications by the trustees. So go ahead whenever you're ready. Thank you.
Great, thank you so much. My name is Jamie Jennings. I'm not only a parent to 2 children in the OCDSB, but I myself grew up in this school community. I've always believed that our school community was one that's caring, inclusive, and safe. Sadly, we recently had to remove our kindergarten student from her school, not because of the risks from COVID, but from the risks of unproven COVID safety measures, which we fear may have long-lasting consequences. Not one health or education authority has been able to provide parents with a risk versus benefit analysis on school COVID policies. What are the long-term consequences of masking young children all day, social distancing from their friends, and of being educated in a culture of fear? The OCDSB COVID policies are robbing kids of their rites of passage. We're going on the 3rd school year where children have not been able to try out for a sports team, join a school club, attend a dance, or even learn to play an instrument. Ontario kids have faced some of the longest and harshest lockdowns in the world, and they are falling behind. As the province of Ontario has proven, mandates are ineffective. They serve as a diversion to create the optics that we're taking tough action in the name of safety. But in a school setting, mandates only serve to destroy the mosaic of our school community. Who do mandates hurt the most? Elephant in the room. According to Stats Canada, and as referenced by Quadro before me, mandates disproportionately affect people of color, Indigenous peoples, as well as low-income families. Excuse me. Did we take this into consideration when we passed mandates to remove the teachers, staff, volunteers, and other workers from these groups that love and support our children? I'm a hockey coach. I've coached young boys and girls through the pandemic and watched many of them exhibit signs of depression. When the associations implemented vaccine mandates to remove unvaccinated kids from their teams, I refused to discriminate. I stepped down from my role as coach and from the executive. How can we in good conscience teach these kids about bodily autonomy, the dangers of bullying, and the importance of doing the right thing if we won't even take a stand ourselves? Discriminating against children is wrong. Mandates are wrong. Our singular focus on COVID over everything else is hurting our kids. Mandates are creating division, promoting segregation, and teaching discrimination. This divisive mentality trickles down to the playground. Unvaccinated kids are routinely ostracized, segregated, and bullied. They're teased and taunted on social media. They've been kicked off their sports team and uninvited from social events. They're scapegoated for any COVID cases within the classroom or school. And these are children we're talking about. So before we vote in any more COVID policies or mandates, I urge you to sincerely think about the children's and the family that these are hurting. A lot of times these things seem like a good idea on paper, but if you actually had to look a child in the eye and tell them that they can't come to school, they're not welcome in this community, and they're somehow too dangerous to be around their peers, I don't think you could do it. Why? Because I want to believe that you guys are good people and you truly have the best intention for our kids. And that's why you're in this role as trustees. Our children are in crisis. You hold the power to make their school life as normal as possible. And so many families and kids are begging you to do that. It's time our children stopped shouldering the burden of provincial hospital and healthcare mismanagement. You have the opportunity to actually practice what we preach as a school board. Let's be the caring and inclusive community that we claim to be. Let's let kids be kids, bring back normal, and say no to mandates.
Thank you very much, Ms. Jennings. And are there any questions for the delegate? And seeing none, I'd like to thank you very much for your delegation. You're
Thank you guys.
certainly welcome to watch the rest of the meeting on live stream. Sorry about that. I said YouTube, but it is actually on live stream, the link being on our website and on our social media channels. So thank you very much. And we're moving on to our 2-minute delegations now. And our next delegate is Neely Kaplan-Mirth. Are you with us today? I can see that you're there down at the bottom. And I just can't see you visibly. Are you with us? Okay, and thank you very much. You have 2 minutes to delegate, followed by possibly 3 questions of clarifications amongst our trustees. So go ahead whenever you're ready.
Good evening, trustees and colleagues. My name is Dr. Neely Kaplan-Mirth. I'm a family doctor in Ottawa. School is an essential service, and school safety should have been prioritized for all children and educators in Ontario. The decision to keep schools closed for the first 2 weeks of January was based on the real risk to children and educators, acknowledging that risk of illness, hospitalization, long COVID, and death for children and educators. COVID is airborne. Classrooms pose a risk because class sizes are too large. Ventilation is poor in most classrooms. Children take off their masks to eat lunch. Younger children who are too young for COVID vaccine and children with special needs are often unmasked. And most educators and children and their families still do not have access to rapid tests, level 3 respirators, let alone the ability to access PCR tests, with rapid tests or isolate. Also, we need more time to give children and educators their COVID-19 vaccine. We are still at risk. According to ministry data, we are at peak Omicron wave with a provincial R estimated at 0.73, although with the lack of testing, we may be closer to 1. Omicron is currently peaking in younger age groups. Hospitalizations are increasing for younger individuals. 1/4 of children who have been hospitalized in Ontario have been hospitalized in the last 6 weeks. That's 98 out of 400 pediatric hospitalizations throughout the pandemic. We cannot have a let it rip approach to Omicron, not when children are dying, not when our hospitals are crashing, not when patients are struggling with long COVID. The most vulnerable families are the least likely to be able to protect themselves. We want children to be in school for their learning and their general well-being, but not at such a great cost to their health, to the health of their families, to the health of the community, to the health of educators, and to the further collapse of healthcare. The safest way to proceed is to keep children at home until we have the tools that we require in order to have children and educators safe. We must ensure that every family in Ontario, every educator has access to daily rapid tests. We must ensure that everyone has access to N95 or level 3 respirators. We must ensure that we rebuild the capacity for testing, PCR testing, and reporting in our community.
Excuse me, can I ask you to wrap up, please, as you're...
Yes. In Ottawa, we have made great progress with vaccines. However, it is not safe to return to school until the majority of children and educators have had all their eligible doses of vaccine and until we have these other tools in place. Thank you.
Thank you very much. And we do have questions, and we're going to start with Trustee Lyra. Go ahead.
Hi, Dr. Kaplan-Mirth. I'd like to open by thanking you for giving out more than 1,500 vaccines in schools over the last week. My question is, you talked about immunization rates of children in our schools. What are the immunization rates of young people in Ottawa?
So right now, we have only 64% of children ages 5 to 11 have had their first dose, but only 6% of those children have had a second dose, which is necessary for them to be safe. It's the difference between whether or not they end up in hospital. For adults, for educators, if we assume that most educators are between the ages of 18 and 49, only 28 to 45% of those have had a third dose, which again is considered absolutely necessary to keep them safe, to keep them from hospitalization, from ICU, from death. So we have not even nearly reached our targets. And also remember that the people that we've just given the vaccine to, so those 1,000 people that we gave vaccine to on Sunday and the 500 kids that we gave vaccine to yesterday, we need at least 2 more weeks before those doses are going to be effective for these people. So we are not ready to open up just based on vaccines. And we know, like, there's already the Immunization of School Pupils Act. There's a requirement that all students in school have to provide proof of vaccination when it comes to diphtheria, measles, mumps, rubella, varicella, and other vaccine preventable diseases. Right now, sending our children to school. Let me just finish my sentence.
You've answered the question.
Let me just finish. No, this is important. This is about immunization. Sending our kids to school now, knowing that they're not immunized, would be tantamount to sending our children into something equivalent to a meningitis outbreak or a measles outbreak, which we would not allow. Those are vaccine required. Those are diseases that have vaccine mandates in school, and we would be shutting down schools if there were such outbreaks. It's the same with COVID-19.
Thank you very much. And moving on to a next question, Trustee Campbell.
Thank you very much, and thank you very much, Dr. Kaplan-Murphy, for your presentation and information. I guess what I'm gathering in some is a bit of a difference of opinion, perhaps, with our local OPH in terms of whether we're ready to open up with sufficient layers of mitigation or not. And I guess I'm asking if you agree that there is sort of a difference of opinion there, to what do you ascribe that difference? I speculate that one of the differences may be that OPH is looking at balancing a number of community health factors, including mental health and socialization and others, as part of the perhaps subjective mix of factors to consider and balance. But I speculate, and really the question is for you.
So to address the issue of mental health, with all due respect, if the Ministry of Education or the Ministry of Health were concerned about children and mental health, we would have funding for mental health services for children. Speak to the teachers who provide mental health supports to students. Speak to the social workers who provide mental health supports. We don't need to think of this as a mental health crisis. We need to think about this as a crisis of the entire health system, and children are just as much under stress going into schools, knowing that they are then at risk of getting COVID, of bringing COVID home to their families. We are not doing anybody a service by sending our children in knowing that they are going to get sick, and then they end up at home sick, and their families also are at risk, and especially children who have younger siblings who haven't been able to access any doses of the vaccine. So the answer to the question in terms of the discrepancy is, one side is politics. Ottawa Public Health is bound to whatever Ontario says. So for the same reason that we're saying 5 days of isolating is not enough, that's a political maneuver. It is not enough to actually keep COVID from spreading in the community. Opening up schools is a political choice. It is not a choice that is grounded in the best health advice.
Thank you.
Thank you very much. And unfortunately, we only have 3 questions, so I'm going to have to go for the first person to put their hand up, and that's Trustee Jenkins.
Thank you, Vice Chair Penny, and thank you, Dr. Kaplan-Murphy, for your presentation. And I guess actually you did answer my question, really, so I apologize to Trustee Bell. What do you consider to be an appropriate timeline then for kids to return to school in person?
So for example, as I said, for those kids and for those educators who we just gave the vaccine to, we would need about 2 weeks for that to be effective. But also, there are still so many kids we haven't yet given that vaccine to. So are we willing to continue to do absolutely everything we can to get vaccine out? Yes. I will cancel my other days of family medicine practice and keep holding Jabapaloozas, and public health will keep doing everything it can. However, the factors that are going to play into whether or not it's safe, it's not just vaccines, it's all the layers of protection. We need testing and reporting to be possible again. We need access to N95 masks for those vulnerable people who do not have deep pockets and cannot purchase them. We need rapid tests to be available. We need HEPA in every classroom. And the you know, like all of that, how long will that take? Well, that depends on the political will of the people who have power. And I am just a family physician with many colleagues across Ontario saying it's not good enough, it's not safe right now, and we will not be sending our children to school.
Thank you very much for your delegation, Ms. Dr. Kaplan-Murth. Really appreciate it. And you're certainly welcome to watch the rest of the meeting on the live stream. And we're going to move on to our fifth delegation, and that is Jennifer Mcdonald. If you're with us today, Jennifer.
Yes, I'm here.
Oh, thank you very much. So you have 2 minutes for your delegation, followed by 3 questions of clarification by trustees. So go ahead whenever you're ready.
It's not good enough. It's
Oh,
not safe right now, and we.
Sorry, I was watching, I think the feed on delay. Sorry about that. Okay, sorry. So I'm Dr. Mcdonald. I'm a physical medicine rehab physician. And so that means I specialize in the sequelae or consequences of illness and injury, like physical, cognitive, and emotional consequences. So after patients might leave the ICU or leave their hospital stay, yes, they survived, but what type of consequences are they left with? And that's the type of thing that I see on a daily basis. And we're just starting to understand that with COVID in the form of long COVID. We really don't understand that illness, and obviously because it's a novel virus. But just like my patients who have post-polio syndrome and other illnesses and injuries with chronic sequelae, I think that they would really appreciate for us to try and prevent transmission of this disease as much as possible to prevent those types of functional losses in the future of our children and our teachers. So I really want to just quickly focus again on the airborne transmission of this virus. It is airborne. It is transmitted by shared air. The WHO now admits this. Public Health Agency of Canada now admits this. This was a long time coming. We've really not tried to fully prevent transmission yet using those methods. We need better masks. We can't be using a rectangle like this with gaps all around. We need something that seals to the face. This is a very comfortable mask. It's breathable. This is a KF94. Our kids can be wearing these. Our teachers can be wearing these. They're more comfortable and they seal so that we aren't breathing in COVID-19. This is a nebulizer. This is Bitrix. So this is actually a fit test that I'm sort of doing right now. And this is how airborne spreads, how COVID spreads through smoke. Through this nebulizer. And you can see how concentrated it is if I'm up close to someone. I'm not tasting any bitter solution. If I take this mask off and put this surgical mask off, I can already taste it right away. It's hitting my tongue. So it's very easy to actually upgrade our mask, wear something comfortable that'll actually protect us while we improve ventilation and while we improve filtration in our schools, much like the cholera issues in the 1800s. When we realized that was waterborne, we switched from sharing wastewater and drinking water and separating them. That was the sanitary reform. We need an airborne reform right now that's going to take time. In the meantime, we need better masks.
Thank you very much, Dr. Mcdonald. And are there any questions for Dr. Mcdonald? Trustee Schwartz, go ahead.
Thanks very much, both to yourself, Dr. Mcdonald, and our previous speaker. I think it's always really important to hear from the medical community based on your real world examples and what you're learning on a day-to-day basis, both in your clinics and as you're working out in the community. My question to you is related to long COVID, and you may or may not have an answer to this, but there has been some dispute regarding whether or not there are risks for children related to this, related to COVID, and whether or not hospitalizations are increased and so forth. From your perspective, what would you suggest may be a risk from a long COVID perspective for children and adolescents in particular? What sort of things would we in fact likely see from in a clinic setting like yours
Yeah,
in terms
so
of
I
their-
don't personally do pediatric rehab, and obviously we're still trying to figure out these numbers. I've seen anywhere from 1% to 10%. Let's say, 1% is more accurate. That's still a lot of children with potential long-term consequences. And the problem is that a lot of these symptoms that they're complaining of are things like fatigue, like emotional symptoms, like cognitive symptoms. Cognitive symptoms are a really tricky one, and the one that scares me the most, because a child's brain is developing. Their frontal lobes don't really exist when they're a child. So to say that a child has some very mild frontal lobe dysfunction from a potential infection, we can't actually prove that because we don't know what their potential would have been had they not been injured. That's why children who have brain injuries when they're young, they seem fine. And then as they grow, they don't quite stick up to their peers. So these are consequences that we may not see for 10, 15 years. I have patients who had polio. They were completely fine most of their lives, lived very highly functional lives. In their 60s, that's when some of the weakness starts to come out, some of the fatigue starts to come out, and they have post-polio syndrome. Post-polio syndrome has been denied by many health professionals over the years, including many acute care physicians. It is a very real illness, and we now understand it much better. And so these patients not only had to grow up with these consequences, but they weren't even believed. And the problem with long COVID, it's easy to say, well, these people are hysteric or they're anxious or blame it on other things. And it is a very messy sort of situation. We're in the middle of a pandemic. So I just don't have the answer. I think that a precautionary approach would be to avoid, spreading a novel virus before we fully understand it.
Thank you very much.
Thank you very much. And moving on to Trustee Bell. Trustee Bell, you're muted.
Great, thanks. And through you, Chair, we've heard from a couple of the delegations on the importance of having proper masks tonight. And I just wanted to know if you could speak and clarify when it comes to children's use of these N95s, have they proven to be more effective? And do you believe if we were able to get those masks instead of offering cloth masks to students, if we would be in a much safer position to open schools?
So obviously the idea of an N95 for a child has not been studied because we've never required it. We would never put a child knowingly in a situation where they're exposed to an inhaled toxin or pathogen. Unfortunately, that's the nature of reality right now. No, we don't have the studies yet. I'm sure people are working on them now because we've just certainly out of places like South Korea, there's lots of children's masks. I have a couple here for you. This is a Canadian one, Canada mask. This is the one my daughter wears, and you can adjust the ear loops so that it fits tighter to her face, but still comfortable. Because it actually gaps open, their mouths don't touch it, so it doesn't get all wet and gross, and they actually find it more comfortable. It's extremely breathable, extremely high filtration, and fits very comfortably. So she can wear it without any issues. And then here's an even smaller one. This is a South Korean mask that could also fit my daughter. I just got these recently. And again, you can tighten the ear loops with a knot or whatever to make it fit a bit better. These are very comfortable masks, much more comfortable than a lot of cloth masks because we try and make them lots of layers so that they mimic a filter, and then they're harder to breathe through. They're hot. And they're not good filters. So I've used a high quality cloth mask. I've tested it with my fit tester. It's within seconds, I can taste an overwhelming bitter solution. So we don't have the data, but I think it'll come. And I think a precautionary approach says, yes, we should absolutely be promoting these more comfortable, safer masks.
Thank you. And we're moving on to Trustee Jenkins for question number 3.
Thank you very much. And thank you for your presentation on the masks and the appropriate how to wear them. I really do appreciate that visual. I guess the concern for many parents is when our students, our children take their masks off for their lunches. I'm not sure there is an answer to that, but it really is a big concern for many parents and the students themselves is lunchtime, snack time. What do they do during those moments?
Yeah, I think we can't eliminate all risk, obviously. And when it's freezing cold like today, you can't eat outside. Obviously, that's the answer in warmer weather. Cracking those windows, though, is helpful. I would love to see a CO2 monitor in every room. I don't have mine here, but it's small, portable, not expensive. You can make sure that the ventilation in that room is appropriate so that you can crack the windows a little more during lunch to really make sure your CO2 is, let's say, under 600 if you can. Maybe you wear a sweater during lunch. So obviously, spacing the students is still important because, as you can see, this smoke is much more concentrated here. If I'm standing over here, it's dissipating in the room. So as long as my house is well ventilated, I can stand over here. I'm not tasting any Bitrix over there, but if I'm close, I can taste it already. So distance is still important. HEPA filtration is obviously important right now. And we need to get that into all the classrooms, especially in ones with lunches, and not just, having one in there as hygiene theater, but having the appropriate amount of filtration for that room based on the room size and the ventilation of that room. And then finally, if the break is appropriate, like over the lunch hour, there are probably certain parents that might even want to take their kids home during lunch. That would be another option if it's allowed based on the schedule. But yeah, it's a very tricky problem, and we can't eliminate all the risk. But I do believe dose matters. It matters in animals. All the animal models, inhaling a large dose of this virus is the way you get very sick. So we should try and limit that.
Thank you very much. And thank you for your delegation, Dr. Mcdonald. Really appreciate it. Some good information there, and certainly invited to watch the rest of the meeting on the live stream if you wish to do so.
Okay, thanks very much.
All the delegations for their information and for their delegations rather. And I'd like to point out that there is one written delegation from Greg McDougall that I would suggest that the committee also read moving forward. But right now, we're moving on in our agenda to briefing from, and I'd like to ask Chair Scott for her briefing.
Thank you, Mr. Chair. Two things that I would like to note. First of all, I'm tremendously excited to share the news with all of you that our OCDSB Director of Education, Camille Williams-Taylor, and our Executive Director of the Education Foundation of Ottawa, Clarissa Arthur, have both been recognized among the top 100 accomplished Black Canadian women for 2022. They join a list of distinguished Black Canadian women from all across the country whose accomplishments and leadership will be showcased later this year in a book intended to provide inspiring role models for the many ways that Black girls and women can make their own contributions to Canadian society. So congratulations from all of us to Camille and Clarissa. We are so privileged to be able to work with you. And on another note, this is a total non sequitur to what I just said, but I did want to acknowledge publicly that in our delegations this evening, we did hear from 3 medical doctors, not just from 2, Dr. Kiara Menteng being the first in the emergency room physician, Dr. Neely Kaplan-Murth, a family physician who's done a lot of work on running vaccination clinics, for which I'm sure our community is very grateful. And of course, Dr. Mcdonald, who has just given us some vivid illustration of things relating to masks. So thanks to all of them for their work in the community, in their regular day jobs, and also very much for taking the time to share some of their knowledge and experience with us.
And are there any, does that conclude your briefing, Madam Chair? Is there any questions for? And seeing none, we're going to move on to a briefing from the director. And I would imagine that it also includes your COVID-19 update, Madam Director. So go ahead.
Thank you, Chair Penny, and thank you very much, Chair Scott, for your very kind words. And as always, when we do get this kind of recognition, as myself and Clarissa have, it is certainly on the shoulders of so many who have gone before us, and so many who walk alongside us in the work that we do. So I appreciate the recognition, but I do recognize as well that it is a continuous journey of learning and work together. Next week, the OCDSB mental health team will be offering families an opportunity to hear from and ask questions to our mental health professionals virtually. They will be hosting a group drop-in session or group drop-in sessions for parents and families to ask general questions about how to promote and sustain mental health. There will be general sessions for elementary and secondary families. There will also be sessions for Indigenous and Black families and parents of students with ASD and DD. Please visit our website for dates and information on how to register. In January and February, schools will be hosting virtual information nights for families looking to register their children for kindergarten or for high school. Information can be found on our website. Please help us in spreading the word about these upcoming information nights with friends in your community with preschool aged children or children in grades 7 or 8. And finally, I'm happy to share that we have just been informed that the OCDSB staff members have raised more than $67,000 through the annual United Way East Ontario campaign. Funds raised will support United Way East Ontario community initiatives to combat poverty, support youth, and help people overcome challenges across the region. And so we express great appreciation to the OCDSB team for the support to the community that they have provided. And with your indulgence, Chair Penny, I'd like to move into the COVID update that I think is awaited with interest. Okay. So in the COVID update today, there are a number of items that we want to present and update the community and trustees on based on questions we've received, new decisions that have been made, and continuing changes that are unfolding around the issue of COVID and COVID management in schools. We do know that currently most of our students are learning remotely. There is and has been communicated the expectation that all of our students will return in person on Monday. We do anticipate that further information and guidance will be coming from the Ministry of Education and from the province shortly. We are told that there is going to be an update and announcement tomorrow, but we are working with the proviso and the understanding that our children will be returning to us on Monday in person. For the moment, those students who are moved to remote, we know that they have been provided with some technology and supports, and we also know that some of our students have come to us in person, those students who have very complex needs, who have difficulty accessing their learning remotely. So I will ask Superintendent Lehman to give a very brief update on the remote learning piece. Rather the technology support piece, followed by Superintendent Simmons, who will give us a few words on where we are with our accommodations in person for students with complex needs. And then AD Reynolds will take it from there with a number of pieces around where we are now and where we're going in the management of COVID realities and directions in our schools. So first over to you, Superintendent Lehman, and then I'll just allow you each to pass to the other.
Great. Thank you, Director. And so good evening, folks. First of all, I want to thank all of our schools for certainly great work that they have done over the course of the last week, over the course of the 3 days, Monday, Tuesday, Wednesday, in getting technology supports out to communities. I think shortly thereafter on Monday, after we heard communication about the movement to remote for a more extended period of time. Many of our schools were already communicating with their school communities and actually already generated lists, so they were already ready to go. So we have had 87 of our 145 schools or so report at this point to us based around the number of Chromebooks that have been distributed. So we have about 11,000 Chromebooks that have been distributed. If we look at last year at a similar period of time, we had about 20,000 Chromebooks that were distributed. So we have about 60% of our schools reporting. And I think if we look at sort of a ratio around that, we would anticipate again having about 20,000 Chromebooks that would be in the hands of our students and families that would support access to remote and online learning. With mobile hotspots, we again centrally we deployed about 650 hotspots to families. They went to schools, families picked them up and then activated them. We have also a number of hotspots that were currently within schools that were also deployed. So we estimate that we're at about 1,000, a little bit over 1,000 mobile hotspots again that are enabling our families that for one reason or another may not have access to internet, whether that be in a rural area or for other reasons, access to internet. So enabling students to continue learning with their classrooms. I'll turn it over to Superintendent Simmons.
Thank you, Superintendent Lehman. And I wonder, Mike, if we can get the slides advanced to the special education slide. So thank you very much. As the director mentioned, the provincial announcement did indicate that some students could be accommodated through in-person learning for those who couldn't be accommodated through remote learning. And we did welcome students back yesterday on Monday in designated specialized program classes for in-person learning. I would, I think, through you, Chair, like to ensure that the committee is aware of our appreciation to those employees who returned to in-person work this week in order to support students with very complex needs. They seized the challenge and stepped up to it. Similarly, students who are being served through remote learning at this time, we've also received the resource from the ministry, the Guide to Remote Learning for Students with Special Education Needs, and that is a guide, a research guide that was created by the University of Ottawa for the ministry after having surveyed Ontario educators, many of whom are within our very own district, as we participated in that research study as well, around best practices to support students through remote learning. So as we stand now, some students are in person and other students were working on getting resources out to build capacity in terms of supporting those students accessing remote learning. Thank you very much, Mr. Chair. I believe we're turning it over to AD Reynolds.
Great, thank you. Can we have the next slide? So the provincial announcement last week included a number of changes which signal a shift in strategy from containment to mitigation. This includes a change in testing strategy, and PCR testing is now privileged for healthcare workers and others in high-risk settings, at least at the moment. Individuals are to assume COVID positivity based on symptoms and self-isolate, and these are, as you know, a fairly broad range of symptoms. With this change in reporting requirements, in the past, principals communicated information about COVID cases with their staff and families based on confirmation of a positive PCR test from Ottawa Public Health. Recognizing that at the moment, there is no consistent data source for confirmation, the ministry has changed the reporting requirements for school districts and removed the daily dashboard reporting. So we will not be posting daily COVID numbers as we had prior to the holiday break. We continue to work closely with OPH on this. They just recently received their own guidance from the Chief Medical Officer of Health yesterday, as a matter of fact. And they'll be working closely on this new process with the 4 school boards. And we should have more information about what reporting in the future might look like over the course of the coming days or week. Next slide, please. Screening tools remain incredibly important. Both the student employee screening tools have been updated by the province and OPH. Students and staff are encouraged to use the screening tool daily, and this will be a requirement on return to in-person learning, and it's all the more important as testing becomes or is quite limited. These tools are posted on ontario.ca /school screening and will be added to the district website. The downloadable screening tool will be made available in multiple languages shortly, and we continue to send these out to employees and families. And again, this is probably the most important thing that we can do for our safety is have everyone engage in daily screening, and where there are symptoms or symptoms in the household, isolate. Next, thank you. So Ottawa Public Health has a chart on their website which helps to understand symptoms and isolation periods. Isolation requirements are based on age, vaccination status, and immune health. Anyone who has symptoms suggestive of COVID-19 or is in a confirmed positive case must also self-isolate regardless of vaccination status. All household contacts must also isolate for the same duration as the person with symptoms, regardless of their vaccination status. And it's important that you follow the guidance in the screening tool because it is different depending on the combinations of symptoms and circumstances. We now increasingly are relying on individuals to self-isolate and their household contacts. As we saw prior to the break, a lot of full dismissals of cohorts and classes, that will not be happening during this transition period. Really, it is just counting on individuals to isolate as required. Next slide, please. As has been discussed a little bit earlier in the evening, vaccine coverage in Ottawa, although not complete, remains a piece of good news. Ottawa has very high rates of vaccination coverage compared to the bulk of the province. 79% of the total population is fully vaccinated. And if you move to the next slide, it's just another representation of that. Although mentioned, we have a fairly low uptake in second doses. We haven't reached the time yet for students in the or children in the 5 to 11 age range. Being in the low 60% for their first dose is far ahead of the provincial average. So the work that is happening to promote vaccination in Ottawa is yielding some success, and hopefully it will continue to do so. Next slide. So vaccine appointments will continue to make information available. The OCDSB has been supporting the promotion of vaccine clinics by OPH, and on January 9th and 10th supported the Jabiluza clinics at Glebe High School and Muchmore Public School. These clinics saw vaccination 1,066 individuals at Glebe and 510 more at Muchmore. So vaccine appointments are available through public health and through pharmacies. OPH posts information on social media when new appointments become available. If at all possible, please do monitor social media, OPH social media. It is a good way to know when there will be appointments coming available. It worked in my case. After school clinics for second doses for children aged 5 to 11 and 12 to 18 will be available in the coming weeks, and we're already working with OPH on resuming those. Next slide, please. So booster doses are becoming increasingly available. They're not changing the definition of fully vaccinated at this time, but certainly booster shots are encouraged. The ministry has advised that school boards will be expected to report aggregated and depersonalized statistical information regarding third booster dose coverage for individuals covered by the vaccine disclosure policy. At this time, booster dose information will be collected for informational purposes only, as the definition of fully vaccinated has not been expanded to include third booster doses. And again, this pertains just to staff. The change to third dose information collection and reporting are required by the first Friday in February. Masks continue to be an important part of our different layers of protection that we have in our schools that on a collective, on an aggregate, are proving fairly effective and seeing slower rates of transmission within school buildings and in the community. So masking continues to be a key protection strategy. Medical masks continue to be part of the personal protective equipment provided to staff. In addition, the ministry has made non-fit tested N95 respirators available for employees who choose to wear them. The schools are in the process of receiving those now. The ministry has also provided 3-ply cloth masks for students, and these will be distributed when students return to school, optional for parents and students to use. Next slide, please. So ventilation, we've heard a lot of conversation around the importance of air quality and ventilation and being a mitigating strategy in the protection against COVID. The ministry has advised that the district will receive 81 new standalone HEPA filter units. These are in addition to the more than 2,300 HEPA filters in active use across the district. Prior to reopening in September 2020, the district prioritized work on ventilation to enhance air quality. This included the recommissioning of all heating, ventilation, and air conditioning HVAC equipment, which required operational testing and inspection, repairs as needed, thorough cleaning and filter changes, and the reprogramming of ventilation systems. All ventilation systems were reprogrammed to comply with the ASHRAE standards and public health recommendations, including creating purge cycles that exchange the building air with outdoor air, increasing ventilation rates during other school hours, outside of school hours, to a fixed constant rate, and operating ventilation systems longer, 2 hours before and after occupancy. The OCDSB investment in our central building automation system enabled us to modify our HVAC systems programming to accomplish this. Next slide, please. The OCDS website has a very detailed information page about ventilation in our schools and buildings, including the school-specific information, the standard school ventilation measures report. It's an Excel file which is available, and it provides a snapshot of school ventilation and filtration measures taken at each school. In addition, we have also compiled additional details according to school at the links below in the PowerPoint, which will be made available. Next slide, please. We all know that the pandemic and this most recent round of closures takes huge toll in our community, and especially on the most vulnerable members of our community. We continue to provide mental health resources and supports to families and students. We have provided information to communities whose first language is Somali or Arabic, and we've been working with ONFI to address food security and nutrition programs and their resumption. Next slide. So next steps, we're currently reviewing the new health guidance and trying to figure out what impacts it will have locally. Collaboration with OPH continues and is more important than ever. We anticipate provincial guidance tomorrow. We will be watching for a release of some more detailed guidance to hopefully see us through a reopening. Communicate updates to families and staff by Friday at the latest. And we'll be, of course, meeting with our principals and managers to discuss operational impacts. We are planning for a return to in-person learning for all on the 17th, other than those who are currently in OCV. This direction is supported by OPH. They have been an advocate for having students having the option to learn in person. And as mentioned before, we will continue to work closely with them. Things are certainly in a transition phase. We're not entirely sure where everything will end in terms of testing and reporting and communicating, but we will keep our schools and our community posted as things develop. Thank you.
Thank you very much for that update. And we do have some questions, and we're going to go to first to Trustee Bell.
Great, thank you. And through you, Chair. And we heard, I guess it was a bit over a week ago, or just a week ago on the 5th, that the Durham board unanimously voted to continue publicly reporting on COVID cases. And I would like to know whether or not we are considering doing the same for the OCDSB. And yeah, let's start with that question. Thanks.
Thank you, through you, Chair. We have been undertaking direction and guidance from the Ministries of Education and Health, as well as our public health partners, about how reporting looks. Part of the commitment in reporting is ensuring that information is accurately conveyed. And so I'll ask Associate Director Reynolds to speak to that, as he has been actively engaged in the processes to date, as well as in now the transition to a new approach through the guidance, direction, and partnership with Public Health and Ministry of Education. So AD Reynolds, would you comment on that, please?
Sure. We have had conversations with the other districts and Ottawa Public Health, and that has not been something that has been, entertained or recommended to this point. With the change in prioritization of PCR tests, as things are right now, and again, it may change in the future, it'd be very difficult for people to receive confirmation of whether or not they do have COVID or not some other ailment, gastro ailment, other virus. And so the reporting, whereas before, it may have been incomplete or delayed, at least anyone who was suspected of COVID that went for a test, we were able to report with confidence that they had in fact COVID and that they had received a test. Whereas now, it'll be a lot of presumptive cases. Presumptive cases probably couldn't get confirmation. And I would be worried, and I think others may too, but I'll speak for myself, that people may get a false sense of security, perhaps, as I would suspect, and I think would be supported in saying this, that whatever would be reported would likely underrepresent the reality of COVID in the community, given how the current variant works. But we'll continue to work with Ottawa Public Health on this. We'll raise this in our conversations with them tomorrow morning when we meet again, and see where they're heading.
Great, thank you very much. And through you, Chair, we've heard of a number of measures that professionals are recommending be put in place in order for our schools to be safe. And given the urgency that we will be opening schools come Monday, if all signs are correct, I would like to compel the chair of the board and my fellow colleagues to come together to write to the ministry to ask that they undertake these important measures, such as ensuring that students have access to N95s, such as ensuring that cases and PCR tests are made available and public, and to ensure that the other measures we can do to keep our schools safe are put in place and funded as soon as possible. And so I very much appreciate the updates and all the things that have gone into opening the schools right now. I don't know if it's a point of order or at what time it would come within the agenda tonight, but I would like to table, if need be, a motion that the chair write to the Ministry of Education requesting that a number of measures go into place. Thank you. Did you hear that last part?
Yes, we did, Trustee Bell, and
Great, thank you.
certainly we can consider that either a new business, or the chair can certainly take it upon herself to write that letter, perhaps without a motion, but I will leave that for new business if that's okay. And are you finished with your questions, Trustee Bell, for the director? You're muted, Trustee Bell.
Thank you. And the only thing that I would ask is when it comes to masking of students, given that it won't be possible, I don't think in the short term, if we could get a run of how much that would cost us as a board going forward to ensure that students have the most appropriate, most effective mitigation measure. Thanks.
Thank you very much. And we're moving on to student trustee Salima Lada. Go ahead.
Good evening, everyone. I do have a couple of questions, but a few of them were already asked by Trustee Bell, so I can just skip over those ones. My first question would be we be able to ask the Ministry for increased PCR or rapid tests if we were to continue reporting cases, so that the information that is reported is accurate and representative of the cases within our school board?
Thank you. I'll answer that, and through you, Chair. The ministry is certainly interested in trying to procure rapid antigen test kits for the school sector. There's competition right now. Certainly healthcare, long-term care facilities are seen as a priority, but education is also a priority, but just maybe a little bit further down. And supplies on RAT tests are limited, what we understand from the ministry. So efforts are underway to get some, but it will probably be a while before we have anything resembling a sustained enough supply to undertake the kind of screening testing that RATs are most viable for. In terms of PCR testing, what we saw from the Ministry of Health would suggest that they do wish to continue PCR testing for students and staff in schools. I think the issue that we're running into right now is simply that the testing system had been overwhelmed, and so they've had to cut back the human resources as much as the test resources in order to deal with those priority groups, healthcare again, and you know, some other key roles. So there is, from what every indication from the ministry and from the health sector is that they are interested in resuming this and having PCR and RAT testing for the education sector. It's just been difficult given the realities of the moment, but it is what we understand a priority.
All right, thank you very much for that answer. Would we be able to, as a board, be able to gather our own information, even if it was on how many students have symptoms of COVID-19, given as those students would have to isolate, or is that not possible?
Thank you. It would be very challenging for with the staff that we have and all the roles that are required and all the jobs that are required to have schools open and operating. We expect to have you know, increased challenges around staff absenteeism as more people are required to self-isolate. So to have school-based staff or some other staff also reaching out and collecting detailed symptoms from individuals would be very challenging. And in fact, I'm not even sure it would be, you know, at all appropriate for school staff to be asking, you know, personal health information of staff and students, and really that's what it would be. We will monitor absenteeism rates, though. We will monitor when we start to see increases in people reporting in ill, as we did before the COVID pandemic, and we'll be reaching out to the health unit to discuss, you know, where we see absences due to illness exceeding, you know, the 10% or 15% marks. Again, that is something we need to discuss with Ottawa Public Health, but we do see things like that continuing.
Thank you very much. And now we're moving on to Trustee Booth.
Thank you. I have a couple of questions. My first question is, if we have children whose parents are choosing not to have them return to school on Monday, what kind of measures will we have in place for the time frame that their parents choose to have them not return?
Thank you, and through you, Chair. So the two principal options for learning in the district remain, you know, OCD and in person, as has been discussed, you know, from February or before of last year through to now. We really aren't able to accommodate significant changes between those two modes, just because of staffing, and it would cost even relatively few number of student changes lead to significant staffing changes, both in school and in OCV. But we do continue to look at those situations on a case-by-case basis. The other option is if students need to be at home because they are self-isolating, and a number will be, they will be able to continue to access the learning management system. Each teacher is required to have one and keep it updated, and certainly continue to learn asynchronously. Teachers are encouraged to provide or think of synchronous opportunities while they have their regular in-person students in front of them. When the entire class or cohort has been home, then the whole thing was able to switch over to you know, synchronous/asynchronous remote learning. In this case, we anticipate most students still being in person. Certainly what we saw with some of our students in our system program classes coming in, we saw very high uptake, higher than before, and people opting to learn in person. So we anticipate most people learning in person, but students who are at home for isolation or other reasons will be able to access the LMS, and we'll be providing some more detailed direction to our principals and through our principals to our teachers on what sort of resources and supports and contact should be available through the coming weeks and months as we deal with the increased absenteeism stemming from the Omicron variant.
Okay, thank you for that. And my second question is, many of our elementary schools have the balanced day schedule. So there, rather than just one lunchtime, there are multiple opportunities for children to be eating, and therefore higher exposure opportunities. Are we still running those models at our elementary school, or are we asking staff to go back to the old-fashioned timetable of just one lunch period and therefore reducing the amount of exposure? Or is it actually smarter to have them more often shorter periods of eating time?
So I'll take the first part, which is at this time, no, we're not asking principals to reschedule their schools. It would be, very, very, very disruptive. And for this reason, our elementary students eat in their classes, typically at their desks, typically spaced out, and remove their masks only for the purposes of eating or drinking. So whether it was one longer opportunity or two opportunities for the student who eats, it's with the same group of people in the same area, and again with some distancing in between. So it hasn't been recommended. I don't think we would think that it would be necessary or necessarily beneficial. We will continue with cohorting outdoors during those breaks. If we do in fact return to in-person learning next week, it'll look very much like it did back in the earlier in the year in September, with students in cohorts, less extracurricular, less mixing opportunities, at least over the next couple of weeks while we get back into the routine of learning in person. But we have not discussed really the possibility or the necessity of rescheduling the elementary schools to have just one break.
Okay, thank you for that. And my last question is there any changing or additional measures that we're taking for children that are on the buses?
To the best of my knowledge, I don't know if anything is being implemented by the operators or OSTA, and CFO Carson could certainly jump in if he knows better. I think we're going to stick with, trying to encourage students to, where possible, stay in their assigned seats and try to seat them a little bit by cohort. I'm not aware of any other additional measures that we realistically could put in place on buses, but perhaps OSTA's discussing it. I'm not sure.
I think the associate director has covered it. Thanks.
Okay, thank you.
Thank you very much. And now moving on to Trustee Campbell.
Thank you to staff for all the information, and to my colleagues for listing more. I only really have a couple questions at this point, and one is another reporting related one. And that is, if I'm correct in thinking that the obligation or expectation still exists that will, if not reporting on an individual case basis, still be reporting on a class closure or school closure basis with respect to COVID. But equally, in the absence of the availability of PCR tests, how will we or OPH or anybody be able to go about determining whether a class or a school closure was due, quote unquote, to COVID?
Thank you. So at the moment, we will not have class closures as we have seen our cohort dismissals due to COVID. If we have a class that appears to be closed, it's because everyone has determined for their own individual reasons that they need to self-isolate. This is, though, under discussion with Ottawa Public Health. As mentioned, they just received some of their more detailed direction yesterday, so it's still relatively new. Some of the ideas that have been discussed have been, as mentioned earlier, monitoring overall absentee rates for illness and reporting those to public health, which may then lead to the declaration of an outbreak, much as might have been done with, say, a Norwalk outbreak prior to COVID. But again, it's still a little bit early, and I know these discussions will continue with OPH tomorrow, but at the moment, we will not have, based on the way things are today, and I want to emphasize tomorrow could be different. We will not have, class or school closures directly due to COVID. We may see those, but it will likely be for operational or safety reasons, perhaps as a result of, say, unable to find replacement staff, which may be an indirect result of COVID.
Okay, but without necessarily, there is no expectation that school boards or local public health units will be reporting around closures due to COVID in any regard. Is that is not actually an expectation?
That's my understanding at the moment.
Okay.
That is not an expectation.
Oh, okay, that's a surprise to me. Okay, well, thank you. And my last and only remaining question then is, I know that just from very brief context, just before the province announced this latest remote learning bout, our local public health unit's lead doctor Etches was fairly fervently in favor of school continuing on a sort of a balance of harms argument to the community health, as I understood it. Is it our understanding that, but obviously situations evolve and can evolve rapidly and are evolving rapidly, is it our understanding to the best of our knowledge that Dr. Eckers and OPH continues to support schools reopening, students going back in person as much as reasonably possible with, layers mitigation, that kind of thing, Jan 17th?
Based on a meeting that I was in with her earlier today, yes.
Thank you.
Thank you very much, Trustee Campbell. And I'm going to go back to student trustee Salima Lada because she was cut off due to a technical difficulty. So go ahead and finish your questions.
I do apologize for the technical difficulties there. My last question was, will the OCDSB be prepared to return high school students to a normal semester come February, especially considering all the issues with Omicron and reporting? And would we be able to facilitate sanitizing desks between like our 15 or 10-minute breaks between classes for all the classrooms? I was just wondering if this is still something we're considering.
Thank you. So at this time, we're still operating and planning for that. It doesn't mean that as we get a little bit closer, and again, we haven't returned to in-person learning yet, and this surge is expected to evolve pretty quickly based on what we've heard from the Chief Medical Officer of Health and others. So we're continuing to plan for that, but as much as we hope that becomes a reality because we think it is in the best interest of our students and staff, we will be able to remain in 2 classes a day if required. So it's flexible, but our planning is at this time, and everything again is at this time, still moving in that direction, but understanding that it may not be possible. We just don't want to make that decision quite yet.
All right, thank you so much for your answers to that question. And once again, I apologize for the technical difficulties.
No problem, not your fault, student trustee. Moving on to Trustee Scott.
Thank you, Mr. Chair. And Trustee Campbell asked some of my basic questions around the reporting thing. I guess one of the concerns about reporting is parents really want to have a sense of, is there a ton of COVID in the school? Is there a ton of COVID in the class? And previously they were able to use our published daily dashboards to get a sense of how many cases. They could go to the OPH website to get a sense of whether or not outbreaks were declared, and the contact tracing looped them in if their child had been in a situation where they might have been exposed to COVID. And now all of that is gone. So parents are very concerned, and I really hope that staff are able to convey that in their discussions with Ottawa Public Health, in the hope of arriving at some kind of generalized proxy, because without the accuracy of the PCR tests, we can't put out bad data. But surely there is something that we could do that would give parents at least some general reassurance, or alternatively some general cause for heightened vigilance, as it were. And those are pretty hard things to pin down and describe, but I do think that it is important for everybody's mental health. So the other question that I had, I was glad to see that in the staff update, there was reference made to things like food insecurity. I am hearing that there are some families out there that are really struggling financially right now. Is there any way, or is there any place they could go to see if we could expedite some of those refunds of the prepaid funds for the extended day program, for example, if that would help out? Who should those people go to?
Perhaps CFO Carson could help us with that.
Chair, I think if when people have those concerns, if they can express them to the on-site supervisor, that's the best place to start. I know I had some discussions last week where we had already begun the process of those refunds. And so from our point of view, I will sit down and take a look at our team to see what we may be able to do in terms of expediting some of that. If there are people with serious concerns, we have limits as to what we can do, but if they raise it with their on-site supervisor, it will come to Julie and I. Thank you.
Thank you for that. That's very helpful. And regarding the question of sending a letter to the minister, I certainly would be happy to put something together. And I do think that the best place to have that discussion is under new business later in the meeting. Thank you, Mr. Chair.
Mr. Chair, with your indulgence, if I might just add to CFO Carson's comments, we also have our Education Foundation is actively working with our social work cohorts to support where families are struggling. And so through school principals as well, that might be another avenue to where it is supports for families who are having difficulties might be undertaken, because we do know that the foundation has been working actively. And so I just wanted to ensure that that path was also identified.
Thank you.
Thank you very much. And moving on to Trustee Lyra.
Hi, I have a couple of quick questions. My first question is that my recollection is the ministry has allowed retired teachers to come back for more than the normally allowed number of days. Is this true?
Yes, the Ontario Teachers Federation did agree to extend the maximum number of days from 50 to 95 for people supporting schools.
Okay. My question is, has this solved any of the specific shortages we usually have had around French teachers or other targeted groups that we're usually having difficulty filling?
I don't know if Superintendent McCoy wants to comment. I don't think we could use the word solved, unfortunately, but it may have helped.
Alleviated?
Slightly reduced. I'm seeing a nod. I don't.
Nothing to add. I think Adrian Reynolds has said it. It certainly will help, but I don't want to lead anyone to believe that it's solved the problem.
Okay.
And do remember, Trustee Lyra, that this has only just come to pass. And so we have not seen the impact on it on full school opening yet. So we would only have last year's experience to draw from. And so we don't know this, we're in a very different place now. So we would be speculating at this point, because we haven't yet seen, that's only just been passed and agreed to. So haven't seen the impact yet.
My next question is sort of building on what Trustee Boothby was talking about. Has any consideration been given to having elementary schools who are eating lunch do it sort of like half at a time, where you have every other desk take their masks off and eat for the first half of lunch, and then the second half of desks, or the other half of desks do it for the second half of lunch, or some similar shift eating?
I can't say that they're, to the best of my knowledge, or at least I've been part of any conversation where that's been discussed. We can bring that up and perhaps a collaborative table. I'm sensitive to, what, especially depending on the age of the students or whatnot, what burden that might put on the classroom teacher to try to manage, okay, you mask off, bite, all right. That's kind of how I'm picturing it in my head, but we can
like half the time, where it's
I see what you're saying.
For the first half, you row of desks, and then eat, and then swap.
Well,
space between students with masks off.
I'll bring it back for consideration. It hasn't come up yet.
All right, thanks. Those were my questions.
Thank you very much, Trustee Lyra. And moving on to Ms. Lamba, go ahead.
Hi, thank you. I think my questions are quick and have been somewhat addressed. I'm sorry, my video's not on, it's not working. Just with respect to, because there's going to be an expectation, there's going to be, it's contagious. So I'm assuming that there's going to be teachers who aren't going to be able to teach, right? And when you don't have replacement teachers, what is the contingency around that? I would think that that's going to happen with this variant.
Absolutely. We saw this happening in the spring of last year. It was starting to happen heading into the holiday break. Superintendent McCoy can speak to more some of the detailed direction that we have given out to schools, but we do want to be fair, and our parents and students need to understand that there will likely be times where classes and perhaps several classes in school may have to be closed. We'll try to give as much notice as we can as we exhaust all the various contingencies that we have to try to bring in replacement staff. Perhaps Superintendent McCoy could just give a bit of an overview or summary of all the steps that a principal might go through in an effort to find replacement staff before we get to that decision to close a class or several classes in the school to in-person learning.
Sure. So we have developed a list of strategies that we have shared with our principals, and those start with what the normal expectation would be, and that is through our to fill behind the absent teacher through the use of our call out system. Principals also have occasional teachers or replacement staff that they know, and so if the call-out system has not been successful, then they may reach out directly. All of our elementary schools have what we call designated OTs, which is an occasional teacher who's in the school every day, and if they are not replacing behind a teacher in that school, then we have a system in place where they can be dispatched to a neighboring school to replace behind an absent teacher at a neighboring school. There are also in-school contingencies that can be used, for example, where necessary, asking teachers to give up their preparation time that they have for that day, and then that preparation time is subsequently paid back to them. Maybe, again, redeploying other staff within the school, sometimes prioritizing the particular vacancy in terms of how staff are redeployed. And we've also, in some cases, deployed central staff to cover behind absences. And so again, a variety of strategies. And then as the AD indicated, if it's looking like based on not only sometimes the circumstances in a particular school, but also what else is happening in the system on a particular day, which has resulted in depletion of those resources just generally, then again, looking at possibility of closing classes. But again, have encouraged principals to be looking at some of those scenarios on a, as early as possible, so that if those decisions need to be made, they can be made as quickly as possible.
Okay, well, thank you. And my last question is just, it's a question. I know the ministry or the government announced that they were going to try to give 3-ply masks for the students. I'm just wondering, how is that different from the surgical masks? Is it different?
Thank you. My understanding is that they are different. I don't believe that the 3-ply cloth mask provides the same degree of at least personal protection as a medical mask. I'm not really an expert. It is a fair question. They are different, but I think the intention is, at least with 3-ply, there is a higher level of filtering both ways than with what some students may be bringing from home in terms of a mask. Again, not an expert in the quality of masks, but I believe that was the ministry intention. So that's why they're providing, I think, a couple for every student in the province.
Okay, thank you. Because I was just wondering, you know, we recently heard wear the surgical mask and then wear a cloth mask for that thing. And I'm just, yeah, so I'm just not sure why.
No, students have always been allowed to bring their own mask from home. They have not been required to wear the surgical mask. That's staff. For staff, the minimum requirement and still the requirement is the surgical or medical grade mask. But for students, they had the option. Many parents do provide students with those masks, but many students are bringing more like cloth face coverings as well. So it's designed to try to improve that. At least that's my understanding of the ministry's intention.
Okay, thank you.
Thank you very much, Ms. Lamba. And moving on to Trustee Blackburn. Go ahead.
Thank you, Mr. Chair, and through you. So my question is continuing on where Ms. Lambda left off. Can staff please address if there's staff shortages, if mixing cohorts is an option? I know there's been some concern in the community expressed about doing that.
Thank you for the question. I know that was something that was mentioned in the most recent or one of the more recent memos from the Ministry of Education. I think I can say there is a significant reluctance to undertake that. I suppose in a situation where in the immediate and we needed to simply provide safe supervision, it may have to be considered because we wouldn't want anyone to actually be at risk of injury due to lack of supervision. It's something that we intend to discuss with Ottawa Public Health tomorrow at our meeting. And I know there has been some questions to the ministry just for clarification, as it is such a departure. At this point, it's not a strategy that we would be recommending as part of the list of other alternatives that a principal may go through in attempting to cover off a staff absence, but that may change as well.
Okay, thank you, Associate Director. Just to clarify, so would we close a class before we would mix cohorts?
We would do a lot of things before we would close a class, but at this point, our practice to this point has been, yes, we would close a class, and we have closed classes before we've mixed cohorts.
Okay, and I think this question might be for Superintendent McCoy, and that's around the dots. So most schools have one dot assigned to them. Is that correct?
Through you, Chair, most schools have one. Some schools have more than one, and that's based on need and requests from schools. I do want to be clear as well that we do our best to ensure that those dot positions are filled, but there is some turnover that happens through the year as well with those dots.
Okay, and what's the process for requesting a dot?
A principal will reach out to HR in terms of that request and put forward sort of the reasons for it. And I would say that in most cases, those requests have been approved. We don't at this point have any schools, at least that I'm aware of, that have more than 2 dots, but there are certainly some schools that have 2. There are also some schools that, while they may have approval for dots, we have had some difficulty filling the positions, and sometimes that's because of the school location. For example, some of our outlying schools, it has been more challenging to fill those dot positions. So even though we may have approved the fact that they can have more than one, the position may be vacant, and so it may not look like they've actually have it.
Okay, great. Thank you. Those are all my questions.
Thank you very much, Trustee Blackburn. Moving on to Sonia Campbell. Is that you? Go ahead.
Thank you, Chair Penny. Hi, Sonia Campbell on behalf of SEAC. One of the questions I have that's kind of pondering with our shortage of staffing, what happens to our CB sites in our units when we do have a shortage of staffing in EAs? Do you mix your cohorts or do you close your classrooms? How do we support our students with special needs?
So I'll invite Superintendent Simmons if he has any further comments, but we would not be inclined to mix those cohorts either. You're right, those sites are of particular concern given the complex needs of the students and the higher degree of training or familiarity that the staff have with those needs. So it can be very difficult. I know that a lot of central staff has been redeployed or would be redeployed to try to support those programs or SPCs, you know, if that's what we were coming to. Again, in an immediate safety supervision, we may have mixing of cohorts, but we wouldn't open the school unless, again, I'm outdated in the direction that's been shared with those two sites, Superintendent Simmons. We would not open the school with that as part of our strategy, the mixing of cohorts, because we are still trying to mitigate against the spread of the virus. But again, in an immediate, you know, these students need supervision now because something happened last minute, a bunch of people have had to go home. We may have to do that just to on the balance of, you know, the immediate threat, but we really will try to avoid that. Superintendent Simmons, I don't know if I missed anything.
Thank you, AD Reynolds. So the only thing I can think of in addition to that is there are some additional staff at those sites. So sometimes it's possible to shift staff around from other assignments. The other thing that can sometimes happen is taking a look at which students are absent from which classrooms, and does that then free up additional staff? But that is very inconsistent in its ability to rely on a way to replace staffing. So in addition to AD Reynolds' comments, there are a couple of other things, but it does remain a challenge.
Thank you.
You know, we're very concerned around some of the operational challenges that we may encounter as more students return to in-person learning. We certainly are. And again, it's never something we desire to do, to close a class or close a school. But if that's what needs to be done for safety, both in terms of physical safety and safety from COVID, then we'll regrettably have to do that. And we'll try to provide as much reasonable notice as we can. If you read through the ministry documents, it may refer to school closures or class closures as a result of operational considerations, and that's what they're getting at.
Okay, thank you very much.
Thank you very much. And moving on to Trustee Scott.
Sorry, Mr. Chair, I did have another question about the masks. Well, actually, two questions. Number one, do we actually know what kind of 3-ply cloth masks the province is providing for students? It seemed to me they did provide us with, I think, cloth masks last year, maybe. But I don't know if those were 3-ply and the big question is always whether or not these are a kind of mask that would actually have a good fit, because from my point of view, the fit is one of the most important things, that it doesn't have a lot of gaps around the edges, no matter how many layers it has. So that's one question. And the second question is in terms of the N95 and comparable masks, how long are those usable for? Because those, I believe, are disposable. They're not reusable and washable and anything. So how long before those would have to be replaced?
So I'll call on CFO Carson and not to put him on the spot, but maybe he knows a little bit more about those cloth masks. In terms of the N95s, they are issuing a slightly better number than at least one per staff member per day. They are not intended to be used day over day. And of course, if something were to happen, they become wet or damaged or pull off, we're supposed to have enough to replace it. At least I believe that to be the case. I don't know if anyone's laid eyes on the cloth masks, but CFO Carson.
Thanks, Chair. The province does supply those cloth masks, and just to remind, it's to supplement what parents provide. These masks are 3-ply. They're a mix of cotton and polyester. In fact, we cut one open just to make sure we had received 3-ply because it wasn't clear from the labeling. They will be similar in quality to what we received before. Unfortunately, this time, due to supply issues, the ministry determined how they would allocate sizes Last time we had a small, medium, and large. This time I think there's small and larges. I think there's very small quantity of mediums. So we'll have to work our way through that. And our logistics folks are considering that as they're beginning the shipments to schools. With respect to the N95s, we hope to hear more from the province about that. The N95s, when being used in their traditional settings, when our staff are using them, for example, in dealing with hazardous substances, it's a one-time use. However, because of the worldwide shortage and because of the nature of their use, there is ongoing discussion with the Ministry of Education, Ministry of Health, Ministry of Labor as to how these can be safely reused on a rotational basis, perhaps. We'll know more about that hopefully after tomorrow, but we have been provided the initial shipment from the ministry was based on approximately 2.25 per day, recognizing that for some staff, their circumstances are going to be different than others.
Thank you very much.
Thank you very much. And a question from Susan Gardner. Go ahead, Ms. Gardner.
Thank you very much, Chair. I wanted to first of all take the opportunity to thank all of the trustees who are here this evening, who I know have been getting many questions, not only from families in the community, but also from educators. And also wanted to acknowledge Dr. Etches for taking the time to meet with us this morning. The presidents of each of the local unions, and of course, Deputy Director, is that the word, was also there, Brett. Thank you for that. So thank you for taking the time. We have, of course, several concerns which you heard about previously. I think Dr. Neely really, sort of hit the nail on the head and talked about, the concerns that we do have. And we appreciate people putting their minds together to try to think of creative ways in order to mitigate some of this. But I have to say, the mental health stresses that are happening right now for our members are huge, and we are concerned for them. We're concerned for them going back, not understanding exactly who in their class may have COVID and who may not. So I guess, in terms of a question to the trustees, I would like to know, would you send your children back right now? And do you think schools are safe enough at this particular moment? Thank you.
Thank you very much, Ms. Gardner. And seeing no further questions for the director on her COVID-19 report, I think it is 8:59. And before we move on to the next item, I'd like to take a little bit of a break, and let's say everyone back by 9:05. Let's just take 5 minutes because we still have some stuff to do. So we'll see everyone back at 9:05. Thanks. Hello, everyone. If you could turn your cameras back on so I can see if we have quorum, please. All right, thank you. Let's resume with our agenda. And we're at matters for action. And the next item is item 7.1, report 22-001, facilities renewal and program and school condition improvement 2021-2022 project plan. And so, Madam Director, would you like to introduce the report?
Thank you, and through you, Chair, I'll ask CFO Carson to take us through the report, please.
Thanks, Chair. And Dan Bradley, our Manager of Facilities, is with us this evening as well to help respond to questions. I know that we have a number of items on the agenda, but I do want to take a few minutes just to go through this report, as it sometimes I think we forget the enormity of some of our responsibilities. Our portfolio of buildings would have a replacement value of somewhere between $2.5 and $3.5 billion in today's prices if you were able to do that kind of work. We range in age from schools that have been built and completed in the last decade to some that go back to the 1800s. As a result, the needs are very different. The physical needs of those schools and the learning needs have continued to evolve. As a result, our planning has focused on the physical envelopes of the building over the years when there was a very, very severe shortage of money for that kind of work. We are now in the last couple of years looking at the other situation, which is we are being provided with a variety of funds due to some of the special initiatives to respond to COVID, to respond to concerns about economic renewal. And as a result, this year, our funding is will be in excess of $100 million. The province does put conditions on those expenditures in terms of how it is deployed across the district, and we do our best to manage those funds in a way that will maximize the impact on students, maximize the impact on summer learning, and to try to ensure that we are building a base for the future. The report outlines the nature of the expenditures. Appendix A breaks it down by the building components in broad terms as required by the province. In Appendix B, we try to take a look at those expenditures by school, but I will also identify that there are numbers of spots where we have provided dollars which cover programs. And so there are some schools where we may not be carrying out a huge rooftop project or a window replacement, but we are in fact in the building doing flooring changes or lighting changes. It is extremely ambitious. You've heard us discuss in earlier meetings the challenges of disruptions in the supply chain mean that we have projects that are 90% complete. We're still waiting for the final components to arrive so that we can finish those projects. We have found over the last 5 summers, but particularly the last 2, the competition for good contractors and for tradespeople, qualified tradespeople, has heated up. It's increased costs of projects, and it has also meant that we face delays in a number of projects. So in planning for this coming summer and for next year, Dan Bradley and I met with the design and construction team and asked that they try to scale back a bit and be, not that we weren't realistic before, but make sure that we were trying to identify and focus on projects that we were comfortable could be complete for the most part by September 2022, creating the least amount of disruption for students in the fall. Also looking at those projects that would continue to meet the objective of improving ventilation and air quality in buildings, as that will continue to be a concern. And that we are well aware that there will be changes as this goes on. This team has carried out a tremendous amount of work over the last 3 years, along with the help of our maintenance and custodial staff. And to be honest, we are not in a position to really continue that pace for this coming summer. It is an ambitious amount of work. You see before you that the recommendation that you have before you is to seek approval for this plan, which will see us completing almost $100 million worth of work this summer, which is, sometimes when we talk about numbers, we forget what's behind those numbers. The sheer scope of the work spread across our 125 school buildings is huge, and it will affect everything from outdoor classrooms to some of the more mundane things, lighting replacements and floor repairs, as well as the more visible projects that are aimed at sustainability, like our solar and our photovoltaic installations. So it's an exciting time as well. Dan, I don't know if there were any other comments you wanted to make before we turn it over to the chair for questions.
Thanks, Mike. Through you, Chair. I think the only comment, Mike, is that the project plan does cover the budget is for 2 years. Now, the value of approximately 100 million is not inaccurate for this year, as we do have a significant number of projects that are still ongoing. As CFO Carson mentioned, we're waiting on a huge amount of equipment to be delivered to complete those projects. So if you were to do an analysis on outstanding work plus the new work outlined in this plan for this year, it would approach somewhere in the $100 million range. And on top of that, we do have our capital that's happening, our new high schools and elementary school. Thanks.
Thank you very much. And that concludes your report, CFO Carson. Okay, thank you. And we do have some questions, starting with Trustee Blackburn.
Thank you, Mr. Chair, and through you, I'd like to move the recommendation, please.
Thank you very much. And would you like introduction?
Yes, very briefly, Mr. Chair, I'd like to thank the superintendent for the report and to Mr. Bradley for all the work he's done on it. And I did have a couple of questions, but by and large, Superintendent Carson did address them. We know that there are labor shortages, and I suspect there could be some supply issues also. And so I'm glad to hear that staff has taken a measured approach, because if we raise the expectations too high and then people are disappointed, I would prefer us to be realistic about our goals, and hopefully we can get as much of this done as possible. Thank you.
Thank you very much, Trustee Blackburn. And moving on to Trustee Lyra.
Hi. So first question. The report says that our school backlog is 643 million and our accessibility backlog is 84 million. My first question is, are those numbers summable, or is one inclusive of the other?
So the numbers for the accessibility backlog would have been included in the overall backlog originally. Now, as I mentioned, I think in the response we gave today, Trustee Lyra, the accessibility backlog information has since been removed from our database. And the assumption is that the ministry is putting together a program to create its own separate entity within the database to account for accessibility. So moving forward, I think we'll see more of a detailed section for accessibility, which will drive those numbers again. So for this year, we don't see those numbers. Those numbers were carried forward from last year, but would have been included.
Okay, so to be clear, there is an $84 million thing that we need to complete, and there is a $643 million backlog of repairs we need to do, and those are independent numbers.
Through you, Chair, I'll have to confirm that,
but I believe that the 84 million was included within the $640 million overall backlog of high need items within that 5-year window.
Okay. So are there other sites that the board owns that we owe backlogs of repairs on, such as the Rideau High School that we're renting out, or Confederation, or at admin buildings or other sites?
Chair, we did take a look. The report doesn't include the closed schools, Century, DA Moody, Grant, excuse me, and Rideau High School, nor is this report designed to include our admin buildings, 133 Greenbank, the Stittsville Depot, since they're not serving students. In those buildings, they do have backlogs. If we were to follow the same methodology as we do for the rest of the buildings, it probably adds over $50 million. A large proportion of that, though, would relate to Rideau High School, that work, rather than being undertaken at that level, would probably be done in the construction of a new secondary school in that at that time.
Okay. So I'm trying to figure out, are there other major financial commitments that we owe or that are a backlog that aren't included in this report beyond the couple that we've just spoken about?
Chair, note, as I think we've indicated in the report, the backlog is calculated by VFA, is a measure that boards use that the ministry uses and boards use to look at each other, a measure of comparability. It isn't an exact number, and it's only one of the tools that we use when we build our program. Having said that, the school condition index is a commonly used measure in the facilities world, and so we're comfortable that it's probably close enough for what we need. There is again, the methodology of it does lead to some challenges. On the accessibility side, the only comment I will make is that the $80 million was based on an analysis of our buildings in the past. We have not yet been able to finalize the pricing, and we are working through retaining staff and a consultant so that we will be able to work through and cost out the requirements of the draft built environment standards that were proposed for consultation in the summer, and to take a look at what those timelines will be. If those were to be proclaimed as is, I suspect we're going to see that cost substantially higher than the $80 million. The issue will be how the government or the ministry of, I forget which ministry it is that's responsible for the operation of it, how they choose to provide any grandfathering of existing buildings, or how they intend to phase in the requirements.
Okay. So my understanding is that we had 20-ish years under the Accessibility for Ontarians with Disabilities Act to phase in accessible buildings. I'm wondering what the district's likelihood, or what the likelihood the district is going to get grandfathering clauses, given that we were given 25 years to get into compliance.
Well, I think, again, I always hesitate to speculate on how these are going to roll out, considering that the standards were only have not even been proclaimed. They've only been submitted for regulation. I don't see how there would be a requirement for immediate compliance. It isn't just one school board, it's the entire education sector, as well as the other public sectors, healthcare and higher, and the post-secondary education. So again, I guess we'll find out. And as we determine it, we will move forward. As always, we don't wait for regulation. We don't wait for the guidelines. If there are changes to a building that are required to serve a student's need or a staff member's need, or parents, we move ahead with that. Granted, it is reactive, but it is a commitment that we have tried to live up to over the years.
Okay. So when I was first elected, the school backlog was 626 million, and now we're at 643 million. And that sounds to me like our buildings are deteriorating faster than we're repairing them. I'm wondering if you have a comment on that observation.
I think we have identified in previous years a measure of funding, of regular annualized funding that would be required just to maintain buildings at that level, and that we knew we weren't there. The latest infusion of funds coming through infrastructure money and some of the others focuses on changes to systems, in many cases which were not obsolete. And so that money doesn't necessarily eliminate backlogs or large backlogs. We also continue to have we've added to our square footage, we've added the number of schools in the past 5 years. So the system as a whole, when I say system provincially, is slipping. We have been able to take advantage, and credit to Dan and his staff. We've tried to make sure that as we are investing these infrastructure dollars properly, as we're making the ventilation changes, that we are in fact taking that opportunity to address some of the other deferred maintenance. But I think it's fair that we, like most public sector areas, continue to slide.
Okay, thanks. I find the fact that we are continuing to slide a troubling fact, but it's not one that we can address in this forum right now. I do have a question. I'm very glad to see the photovoltaic work that is being done in schools and on schools. I'm going to ask a question. My question is, what work has been done to address fossil fuel burning boiler systems and other heating, cooling?
Through you, Chair. So we've started to undertake the board sustainability action plan, which will look at the decarbonization, electrification of our system. We're looking at putting that together for some time early this year for a draft. But that does look at things like converting from gas-fired rooftop units to heat pumps, which we're already doing in our new schools. Our new standard of design for new schools is that. So that'll kind of pave the path for how we're going to approach that in our renewal plan. So that'll outline exactly our expectations, our design criteria moving forward. So it has started. We've got all the new systems we put in place, all the new rooftops we're replacing, and we're replacing with heat pumps. That's kind of the low-lying fruit as far as decarbonization goes. Boiler plants are a little bit different, a little bit more difficult to replace with electric right now. It's not very popular. So there aren't many options out there. So what we're looking at first is that kind of the simpler systems that we can replace with electrical systems, and then we'll move on to the more complex as the years progress.
All right, thank you. I look forward to the plan as it comes forwards.
Thank you very much, Trustee Lyra. Moving on to Trustee Schwartz.
Thank you very much, Mr. Chair, and I appreciate the report from staff. I'm always very interested in seeing the backlog and how we're attacking that. And like Trustee Lyra, I also am concerned that that backlog continues to grow, but I think that that is certainly, our district is not alone in this backlog. We certainly have heard report after report across the province over the last several years regarding backlogs in many school districts. And so really, I think it is incumbent on the province to consider this when it comes to the funding envelope that it is providing to school boards for this type of work. My questions do arise particularly around the special projects, and happy to see that the special initiatives, both around continuation of improvements to the science labs, in the schools. So glad to see that that work is going to be brought back underway. And I was particularly interested to see the solar photovoltaic systems that are going to be put on additional schools. And so my question around some of those solar arrays, I'm wondering, because there's no longer any provincial I'm trying to think of the word, but the province is no longer providing additional incentives for solar systems. I'm just wondering what the payback for these new solar systems would be for these new schools in terms of years of payback on these systems.
Through you, Chair. Thanks, Trustee Schwartz. I'll put together an analysis on that. I know because the way that the province has changed the way that they do fund these, our systems have changed from revenue generating to net metering. So what we do is we use the electricity to offset our costs or utility costs. So that has changed the way we do an analysis on payback. So I will put something together for the group.
Okay, and no rush on that, Dan. I think I would just be quite curious to see what we're looking at, and given the fact that energy prices certainly continue to go up, and I know the education sector, is hit by higher electricity costs. What we're actually seeing in terms of going further with more of these systems across our district, as I think it's great that we're doing this. So I commend staff for following up on the strategic plan in this way, and some of the guidance that the strat plan had provided. So thanks for that.
Chair, if I may, Dan and his staff are in the process of completing our energy plan that we always present to board. And in there, we do talk about the economics of this. Certainly, there was a time when we could install solar systems and they were almost self-financing. Now, with the incentives gone, with the reductions in payments, we're not in that situation. However, as we've said, we go to direct metering. And so that does have an impact on reducing our overall electrical costs. And as we begin to as we continue the shift towards electric and moving away from carbon, then that's a different kind of payback. As the carbon tax moves its way through the system, the price of natural gas, which had been extremely low and still continues to be low, starts to move up substantially. And so the business case to begin that work starts to look better. So those are that's the kind of appendix we usually have in that energy report, and it'll be coming forward in the next couple of months, I think.
Great. I look forward to seeing that report, and Dan, don't worry about doing that further analysis, because it sounds as though much of that will be actually in the energy report then. So thanks.
Thank you very much. Moving on to Trustee Scott, go ahead.
Thank you, and thanks very much for this report. At some point, and I don't mean immediately, could you please provide us with a little bit of information in terms of the current status of whatever we're using as a facilities condition index methodology, and how old that methodology is and when it is expected to change, as well as any information that is out there on what we expect schools to sort of have by way of amenities, systems, facilities, etc. I know there was some work that has been done on that already, but I haven't seen recently just where that is. I know the accessibility standards are in the works, but I'm talking about the school things in general. So if we could have something on that eventually, I would very much appreciate it. Second thing is, I just want to say huge thank you to you, Mike, and Dan, and everybody on the team who's been working on this. I think you must have three-dimensional spreadsheets that you're using to keep track of all of the different funding streams and find all of the different ways to combine little pieces of projects so that they can happen in a suitable time and in a most efficient way, and really maximize the effective use of the funds that are available to us. So thank you all very much for that.
Chair, can I just interrupt for a second? We present this report and we are held accountable for the money. The amount of work that has been accomplished, obviously, Dan's team does an amazing job managing it, our facility staff on site, but we can never forget that cooperation. The key to a successful project is the cooperation of the principal and their staff. And, everybody in the board's involved, everybody from purchasing to finance all the way through. But when we come to projects that we consider successful, they're the ones where we've been able to properly have that support, cooperation from principals, staff, parents. Sometimes we've had to relocate kids out of a building or out of a room, and parents have supported that. And so I think we will certainly take any thanks you give us, don't get me wrong. But I think it's important to recognize that what appears on this page impacts school classrooms and kids at their desk. And that's at the heart of the way we do this planning, and have to give credit to Dan and his predecessors for trying to make sure we can do that as effectively as possible. So thank you.
Thank you very much. And that's all, Trustee Scott. Thank you very much. And moving on to Trustee Bell.
Great, and thank you through you, Chair. Thank you, CFO Carson, for your last remarks and what you said about bringing in the human element and the impact that these costs that we have to spend have on children. My question is, if someone from a school council wanted to look up what is needed when it comes to their school's improvement and what has been completed over the past few years, is there an easy way for that person to access the information? Are there school by school reports or a public portal where people can see what has been done and what needs to be done?
The brief answer is not as easy as we would like it to be. The school backlog information that we discuss is published by the province, but only periodically. I think the information there is probably 3 years old at this point. And so in theirs, parents can see the school condition index of their school. We have in the past provided information to trustees at a broad level of some of the work that's been completed at schools. I have to go back to the format. It isn't easily provided, and I say that just because the information does get pulled from a variety of sources. When we did the district needs analysis 5 years ago, and which is being updated for this coming fall, that's where we identify school by school in broad strokes the kind of work that has been done and that needs to be done. If there are more specific questions, certainly I would suggest that the school council chair and the principal maybe work with us and the area supervisor, and we can sometimes capture that information informally for them. That might be the quicker way.
Great, thank you. And I guess this question goes to the director and yourself, a follow-up. Obviously, human resources, and the ability to upload that information in an accessible and transparent format are limited right now, but I'm hopeful that in the future we would be able to find some sort of data system that would be able to share that. Will we be able to find some sort of data system to share that in the future? That's my question.
We've been looking at it, and I don't mean this to sound facetiously. At some point, it's easier to put that together much like we did on the ventilation piece, where we did the school by school ventilation information, where that was easier for us in the long run than responding to 30, 40 individual questions. So I know that Mr. Bradley has been working with his team to see how we can transfer engineering financial reporting to a format that would be more useful to school councils and to our own principals in a way that would help. But I can't give you a firm date on that. For the last, it's fair to say, for the last 18 months, we've been focused on the doing more than the reporting, but it is something that we recognize is important. And as I say, in the long run, it would simplify some of our own need to respond to some of the ad hoc questions as they come up.
Thank you very much. And seeing no further questions, we're moving back to Trustee Blackburn, who is the mover for wrap.
Thank you, Mr. Chair, and thank you to my colleagues for their good questions and to staff for answering them all. And I look forward to everybody supporting this motion. Thank you.
Thank you. Thank you very much. And with that, I'd like to call the question on this motion as it is written. Parts A and B together. Trustee Fisher?
I thought we were voting, sorry.
Yeah, okay, sorry about that. All those in favor, and since this is a committee, if you could also call out your vote.
Blackburn in favor.
Schwartz in favor.
Lyra
Fisher in favor.
Campbell in favor.
Boothby in favor.
Ellis in favor.
Jenkins in favor.
Bell in favor.
Penny in favor. And opposed? And that passes. Thank you very much. So moving on, next item 7.2, report 22-007, approval of policy P.147.gov, human rights. I'd like to call upon the director to introduce the report.
Thank you, through you, Chair. Today we have the distinct pleasure of bringing forward a policy that has had a long path forward to getting us here to this table. It has been anxiously and anticipated with great interest. As trustees review the letter of transmittal as well as the various appendices that come with it, you will have seen that there has been active engagement with a variety of stakeholders in the development of this policy that we're bringing forward tonight for your contemplation and approval. And one of the stakeholder groups was in fact yourselves with an opportunity for discussion. I don't want to steal Carolyn's thunder. Our human rights and equity advisor, Carolyn Tanner, has been the lead on this work, and she will introduce her very new staff team who have joined us. We're privileged to have some very skilled partners joining us with this work, and Carolyn will take you through with an overview with an opportunity for entertaining questions, but it goes without saying that I do want to acknowledge her leadership because in addition to leading this work, she has also been a part of not just the district but our province in shaping through a professional community of practice this role in the province and in many of our districts. So certainly an emerging emerging and evolving role that will shape and change outcomes and impacts for students and staffs in schools. So at this point, I'd like to turn it over to our Human Rights and Equity Advisor, Carolyn Tanner, and she will indeed introduce her team as well as she proceeds with this presentation. Over to you, HREA Tanner.
Thank you very much, Director Williams-Taylor. And Mike, I would just like to ask you to please share the presentation. Wonderful, thanks. And I'm just going to start by framing the discussion a little bit before we jump into introductions. Before I jump into the presentation, I'd really like to acknowledge the community who was part of developing the policy and the community that the policy is intended to serve. This human rights policy is for the approximately 74,000 humans, most of them children, that the OCDSB teaches in its classrooms, and the approximately 12,000 humans the OCDSB has in its employment to create spaces where students can succeed. We're all here with the mandate to deliver on each child's right to education. This policy is a product of a collaborative effort. It's a product of the efforts of students, families, community members, and staff members who came forward to share their insights, some with support from the amazing team of multicultural liaison officers from OCISO who provided interpretation that enabled newcomers to engage as well. It's also the result of the efforts of a team of staff members, including the Indigenous Education and Learning team, the Equity team, the Policy team, the amazing Communications team, a working group of subject matter experts, and my colleagues in the Office of the Human Rights and Equity Advisor, who helped create safer spaces for discussion and who worked to create a policy that addresses the barriers experienced and that reflects best practices. So I'd like to move to the next slide and sort of position what the Office of the Human Rights and Equity Advisor really is intended to do. It really has two main roles within the district. It's an arm's length office that's intended to operate without interference. And one big portion of what it does is system strengthening. And this involves identifying and addressing systemically based human rights and equity issues and building the OCDSB's capacity to ensure compliance with the Ontario Human Rights Code. Now, one way we figure out what we need to strengthen is through the resolution of human rights complaints. When we look at human rights complaints and investigate human rights complaints and resolve human rights complaints, trends that we see can help point in the direction of changes that need to happen to prevent them from arising in the future. So the office also has the role of developing and overseeing the OCDSB's internal human rights complaints procedure and serving students, staff, families, and community members. And until recently, I was a one-person show, but recently I was very fortunate to have two amazing people join the team. One of them was not able to be here tonight, but one person is, and I would like to invite Jennifer Bang to introduce herself.
Thank you so much, Carolyn. Good evening. I am Jennifer Bang, and I'm one of the human rights officers at the HREA's office. I am a lawyer by training, and previously to joining the OCDSB as a human rights officer, I have worked as an in-house legal counsel at an Indigenous national organization for the past 2 years. Also, I've also been an assistant Crown attorney for the Ministry of Attorney General, and I've also have experience working with a legal clinic who has offered both legal referral and educational services for people with disabilities. I am fluent in English, French, and Pidgin. Thank you very much.
So thanks very much, Jennifer. I'm delighted to have you on the team. And I was also delighted to have Jennifer and her colleague, Christina, sort of come into the process in time to really provide shape and direction and lend their expertise to the policy that's been submitted to each of you today for consideration. So as the director referenced, we've really engaged in a consultation process that was consultative, aligned with the communications plan and the consultation plan that was approved by the board of directors. Mike, could you please advance a couple of slides? Perfect. So the consultation process involved discussions, small group discussions, and a survey. We engaged with employees, unions, federations, employee groups, such as the Jewish Educators Network, the Muslim Educators Network, the Ottawa Black Educators Network, the People of Colors Employee Network, the Learning Attention Disorders and Allies Network, and the Rainbow Educators Network. We also engaged with employees who didn't, that was non-identity based. So anyone was welcome to join in the discussions. We had a similar approach to our engagements with students and caregivers, as well as with parents. And we also engaged with various advisory councils and federations. Next slide, please. And these are the barriers that people identified through these discussions and in the survey. When we asked people what it was that they were experiencing currently at the OCDSB when they tried to raise issues related to their human rights or related to discrimination or related to accommodation, they talked about a lack of accountability. They talked about lack of transparency in the process and a real fear of retaliation if they raised an issue or made a request. There seemed to be a lack of knowledge about their rights, a lack of knowledge about the process that they should engage in order to request an accommodation or seek resolution of a concern. And there was a lot of distrust. People were scared of not being believed. The process came across as too complicated. Many people talked about the lack of representation and the difficulty of bringing something forward without having someone who can accompany you and give you support and act as an advocate. They talked about the current system being unable to effectively deal with microaggressions and that the current process isn't effective for race-related concerns. They also discussed the need to revise how we were addressing disability issues within the district. So these were some of the barriers that came through loud and clear through both the survey and through the discussion. Next slide, please, Mike. And then we asked stakeholders what they wanted. We asked them sort of what they would like to see and what kind of process or what kind of structure we could build that would work for them. We asked them to say 3 key words to what they wanted to see in a process. And this is really what came through in their responses. They were really concerned about confidentiality and transparency. They wanted a system that would actually take action. They wanted the option of anonymity. They wanted to feel respected. They were worried about privacy. They wanted something that was accessible, where there was safety, where they would be believed. So these were thinkings and concepts that we really tried to keep at the forefront of our mind while we were trying to develop a policy that would serve the needs of the people that we spoke to and the greater community that we want to serve. Mike, could you please go forward to the next slide? So now I'm going to talk a little bit about some of the key elements of the procedure and the key elements of the policy, that we've brought forward. First and foremost, what this policy does is that it embeds a human rights-based approach to our work within the district. A human rights-based approach essentially has 3 prongs: equality and non-discrimination, participation and inclusion, and transparency and accountability. Next slide, please. It also very intentionally enshrines children's rights. We are all in the business of delivering education to children predominantly. And really what we need to be doing is ensuring that children's rights are at the center of what we're doing. And in particular, the best interests of the child and the participation of children in decisions that impact on children. So what this policy does is it really sort of upfront acknowledges children's rights and enshrines them into our practice here at the OCDSB. Next slide, please. So when we talk about equality and non-discrimination, what the policy does at the forefront is to really kind of reference those really big and important foundational documents internationally that have sort of set the standards around the globe for equality and non-discrimination. We're talking about the Bill of Rights, the Universal Declaration of Human Rights, and other international conventions. It then also references Canadian federal laws and provincial laws that are really reflective of those foundational standards that are derived from the international standards. And it's aligned with what we're already saying that we're going to be doing in the OCDSB strategic plan, in the Indigenous Equity and Human Rights Roadmap, in commitments we made to the International Decade for People of African Descent, and to the Truth and Reconciliation Commissions of Canada's calls to action. So this is really the framework that the policy establishes. And it's this framework that's really going to provide a framework that reinforces anti-oppression and anti-racist practices within our system. Next slide, please. The policy also creates opportunities for the participation and inclusion of OCDSB community members, the participation and inclusion of rights holders, including students, parents, staff members, and community members in decision-making that impacts on them is reinforced by the policy. It's reinforced by prioritizing engagement with the OCDSB community. It creates a proactive obligation to inform students, parents, and staff about accommodation in the complaints process. It requires the development of outreach materials to inform people about their rights. And it also enshrines the principles of dignity, individualization, and participation and inclusion in the accommodation process. Next slide, please. Finally, when we get to the third prong of the human rights-based approach, we're really talking about transparency and accountability. And the policy emphasizes transparency and accountability of the OCDSB as a human rights duty bearer to its rights holders within the OCDSB. And this is done in a few ways. It's done by including a requirement to report against human rights-based organizational change plan. It embeds reporting and appraisal on equity and human rights in performance appraisals for educators, vice principals, principals, managers, and supervisory officers. And it creates expectations in those areas. It also creates a public reporting obligation on disproportionalities based on protected grounds. And it also creates a public reporting obligation on human rights trends and complaints by the Office of the Human Rights and Equity Advisor. On to the next slide, please. What the policy essentially does is really try to standardize an approach within the OCDSB to human rights related work. So we're standardizing approach to rights and responsibilities, to inclusive design to prevent discrimination, to accommodation, changes that we need to make in order to avoid discrimination in individual cases, discrimination and harassment, complaints, prioritizing remedies that are remedial and restorative, and the avoidance and prohibition on reprisal. Next slide, please. So the policy intersects with various OCDSB complaints policies or policies that sort of regulate behavior, including the code of conduct. It could possibly intersect with suspensions and expulsions, staff misconduct, and respectful workplace. That sort of intersection will really be guided through the procedures in how we will engage and create harmonization between the different policies and procedures. On to the next slide. And essentially, this is the complaint process that's established by this policy. It's not so much talking about the process as much as principles that will guide the process. First, there's complainant choice. The complainant can choose where to bring a human rights complaint forward to. It could go forward to the Office of the HREA, or the complainant could choose to use an existing mechanism like the existing complaints procedure that we already have. A second principle is that there are no parallel investigations. So if a complaint is accepted for investigation by the Office of the HREA, there will be no parallel investigation permitted on this exact same issue in another mechanism. And this is to really stop the idea of forum shopping and searching around for different answers. The OHREA, the Office of the HREA, will either accept the complaint and investigate it or refer it on to another mechanism. Findings from the Office of the HREA and recommendations are final. The district then determines what remedies it will apply. And the director considers the recommendations and deploys implementation. Finally, the Office of the HREA reports on trends, complaints, findings, and recommendations cyclically. So this is really sort of the structure that we're putting in place to really create a way that OCDSB community members will really be able to enforce their rights within the OCDSB. On to the next slide. And that's it. I would love to have a discussion around this and happy to answer any questions that arise as a basis of the policy. Thanks very much.
Thank you very much. And we have some questions. And I'd like to start with Trustee Lyra. Go ahead.
I really like that you have enumerated the rights of children. So that's going to sort of lead into my first question. 3.3K enumerates a right to privacy for children. Can you explain how we plan to actionalize this if this policy is passed? How would it apply to lockers? How would it apply to bags? How would it apply to messages sent over the Wi-Fi of the school? What is the right to privacy going to look like when we actionalize it?
Thank you, Trustee Lyra. Is that the end of your questions for now? Would you like me to address that right away?
I'm going to do them one at a time because I have a litany of questions and I don't want the answers to get lost.
Thank you. Through you, Chair. So 3.3 and the children's rights, it has a clause right at the top, right at the introduction part, that says it's subject to limitations permitted by law. So all people's rights are subject to limitations, right? So we are within, this is not going to change any approach that we already have to, for example, lockers, like you said. However, children do have rights that are separate and distinct from their parents. So what this says is that children have rights that are separate and distinct, and children's rights and their capacity to implement their rights evolves. And what the Convention on the Rights of the Child says is that as children evolve and as their maturity evolves, they are able to take more of a leadership role in exercising those rights. Does that answer your question?
Kind of. I was looking for, perhaps I was looking for a different answer. I tend to think that children deserve more privacy than the school board has given them historically. And I think it would be worthy of debate to have us discuss whether or not a right to privacy should extend to bags they bring onto property or lockers. And so when I read that, I was excited because I thought we were going to be having this conversation about a right to privacy will include a right to their own personal, like the things they keep in their book bag, the things they keep in their locker, etc. If that's not the case, can you just affirm that we are not going to be having that discussion in relation to this policy?
Through you, Mr. Chair, I can affirm that MFIPA still applies, right? So privacy protections that are engaged under MFIPA apply, but my understanding of how this policy would play out is that it wouldn't necessarily make changes to current things that we are doing, for example, in relation to that particular example that you provided of lockers and personal belongings.
Okay, interesting. My second question was about the OHREA recommendations. When you make recommendations, are the recommendations to a complaint public? And are they accessible to the complainant? So if you have chosen to make a recommendation or to implement something, does the complainant know what recommendations have been implemented? Or are those accessible to the public? Those are sort of two questions about the same thing.
So through you, Mr. Chair, and Madam Director, if at any point you would like to engage instead of me, I'm sort of unclear on how to do this. Okay, I'll just take the floor, and if you would like to back up, please do let me know. So in terms of recommendations from the Office of the HREA, recommendations will always be shared with the complainant and the respondent and the OCDSB. Individual recommendations related to cases would not be made public, but there is an cyclical reporting to a public reporting cyclically on complaints and reports that would report more to systemic recommendations that are made. And then it really falls to the director on really considering those recommendations and determining the best way forward. So recommendations will come out of our office, but the Office of the HREA is not involved in the implementation of the recommendations or in determining whether the recommendation that's made is the one that should actually be implemented to resolve the issue.
Okay, so just to be clear, that means if I were to make a complaint and then there were to be a recommendation made by the OHERA, I would hear what the recommendation was, but it wouldn't be public.
That's correct.
Okay. Yeah. So my follow-up question to this is 4.28 includes termination or reprimand of employees. And it has been, my understanding is that it has been the practice of the OCDSB not to inform anybody about reprimands to staff or termination of staff. Can I get a comment on how that might interfere with our collective agreement?
So recommendations through you, Mr. Chair, pardon me. Much of this still needs to be determined by procedure, right? So when I'm thinking of recommendations, I'm thinking of system recommendations. I'm not thinking of recommendations for remedy necessarily. So when you looked at the slide that sort of talked about the complaint process, essentially the Office of the HREA will investigate. An investigation you talk to a bunch of different people, you get a bunch of different opinions about what happened, and based on the evidence you hear and weighting of the evidence, you come up with a finding of facts. So based on the finding of facts, there would be a finding as to whether or not in most cases, whether or not a human rights violation occurred. And if it did, there would be recommendations to remedy that. That doesn't necessarily correlate to recommendations for discipline. So discipline is really within the realm of the district to decide what type of discipline may or may not be appropriate based on the recommendations that were made, but the recommendations might be made around the remedial piece and the restorative piece and the systemic piece to prevent it from happening in the future.
So if a recommendation would be that this person has in fact, I'm trying to understand what you would be telling a person who has been who's filed a human rights complaint, who has been subject to human rights violations. That would, what would you be telling someone who's been subject to unwanted sexual advances from a teacher, for example? And the OHRE says, yes, that definitely happened. The recommendation goes to the director's office that this did happen with the recommendation, because the word used is with a remedy that this person be terminated.
So if I may, I'm gonna jump in here because I think that this is where the distinction, one of the things that was in one of the earlier slides was the fact that there are intersections with a number of areas of responsibility in the district. So the example, Trustee Lyra, that you've given would fall under the purview of or the category of misconduct. It would be investigated actually through the human resources Services Department. And then there would be, this is a different question. It's not a question of a recommendation, but this would actually be an outcome of in an investigation into an infraction. So the Office of the HREA does not have the purview around where it is a remedy may be suggested. This is different from a remedy. It is an outcome of an infraction, which would have and could have repercussions up to and including termination of employment. But that would fall within, so when HREA Tanner identified that when a complaint comes forward, a part of the triage is looking at where it belongs. One of the, a case like this situation would therefore go into, this needs to be investigated through labor relations because this is where it belongs. Similarly, certain situations that may be a safe schools issue may belong in a different purview. It is very complex and interrelated because some of the situations that fall into those categories also have a human rights component. But a very big part of the Office of the HREA actually speaks to the high level when we see multiple practices and speaks to a systemic problem that we may have in our system. That at that point, there's a recommendation around systemic practice that then falls into my lap from the point of view of, Madam Director, you have a systemic issue here, what kinds of structural changes, and therefore there's advice from the HREA office around structural changes that need to be contemplated to remedy a repeated or a systemic situation.
I guess my question is,
Trustee Lyra, I'm
I'm
gonna have to put you on the, yes, you're over your time. So if
my apologies.
put you at the second time speakers list, if that's okay, and we'll move on. We'll move on to Trustee Campbell.
There we go. Thank you, Mr. Chair. I'll move the motion in all of its parts.
Thank you very much. And do you have introduction, Trustee Campbell?
Not required. It's a great piece of, apart from it, it's a great piece of work. And I appreciate all the consultation that went on to get to this point. It coheres nicely. I do think it has to be read together in its entirety to understand how all the parts work together properly. And that took me some time to achieve myself, but anyway, very much appreciate it. But I don't want to take up my 3 minutes on that. I actually have a couple of tweaky amendments in the series of questions I may not get to in this first round. So the first amendment, moving right to it, and I believe they shouldn't be controversial, but one never knows. I'll put it in the chat. So basically, the First Amendment would to replace what is the current 1.0C to break it apart. Currently, the transparency and accountability applies really only to the complaints process. And I believe that's too narrow an understanding in this context of the transparency and accountability required around everything to do with human rights procedures and machinery. It's not just the complaints process, and which I believe was the original scope of this. So this would, in a sense, break it out to make the second part, remedying harm, working to restore relationships, something standing in its own right as something important, and transparency and accountability equally standing more generically in its own right of some importance, just to clarify our commitments under the objectives section. That's my First Amendment.
All right, Trustee Campbell, so you...
and my clock continues to count down.
Okay, clock, stop for a sec. You've proposed an amendment that it's not clear to me on here. Where does that substituting for?
Yes, that would be substituting for the current 1.0C. It's basically creating a new D and making the current D an E.
Okay, so you're amending the document itself, not the recommendations of the motion.
Oh, that's correct. Yeah.
All right, so I have a speakers list to the main motion, but we do have an amendment on the floor by Trustee Campbell that amends part 1.0 of the policy, part C, as per on the screen. And so,
Mr. Chair, is it friendly?
that's what I was going to ask. If this is not friendly, please speak up. And I'm not hearing anyone object to it being friendly. And so we're going to call the question on that right away, on that amendment. All those in favor, and just speak out.
Lyra in favor.
Schwartz in favor.
Ellis in favor.
Up in favor.
Campbell in
I'm
favor.
in favor.
Jennings in favor.
Boothby in favor.
And opposed? Okay, that passes. Thank you very much. So that amendment is adopted to the document itself.
So the second tweaky amendment I've put in the chat here, and this would be simply, in fact, I believe that the HREA, our HREA suggested that actually in the oral intro, that system level recommendations made public, but 414D doesn't actually contain that clarification. So what I'm suggesting here is that in addition to what's already in place for 414D, monitoring human rights trends and producing regular public reports on human rights concerns, and it currently reads "and complaints," the "and complaints" be changed to an Oxford comma complaints, sorry, a comma complaints, and then insert the Oxford comma, I'm missing it here, and system level recommendations made. And I think that's aligned with what I understand the oral intro to have been.
All right, so the amendment is on 414D. And we're back to Oxford commas, are we here? So
It's my amendment.
man, okay. I thought we emerged from that rabbit hole, but okay.
So instead of and complaints would be changed to comma complaints, comma, and system level recommendations made. That's the change.
Okay. So it looks like the addition of a comma to me. Is that friendly?
No. It's the addition of and system level recommendations made. That's the substantive part.
Right, you are correct. Okay. And if this is not friendly, please speak out.
May I ask a question before I make an opinion to staff?
Ask a question.
Thank you, Mr. Chair, through you. I just want to know from staff, would they foresee any potential situation where it wouldn't be prudent to make a system level recommendation public?
Madam Director?
If I may, HREA, Tanner and I had a lengthy conversation about this earlier today. And I think that the amendment gives us the scope to be able to, generally speaking, be able to provide updates to trustees and the public on system level recommendations as a part of a general reporting piece. But I think embedded in that also gives us the purview to exercise appropriate discretion where there may be a legal or privacy-based reason for not providing a specific piece. We interpret the system level recommendations here as those that are broad in scope that would not be speaking directly to individual people or specific cases. So this amendment from our point of view is one that does speak to transparency, that does allow for us to do that with good faith without contravening any operational pieces like privacy of an individual or privacy to an individual situation. Does that answer your question,
It does,
Trustee
Madam
Blackburn?
Director, and therefore it's friendly on my part.
Right, so I say again, is if this is not friendly, please speak up. All right, therefore I'm going to call a question of this. All those in favor, please speak out.
Lyra in favor.
Ellis in favor.
Schwartz in favor.
Blackburn in favor.
Campbell
In favor.
Scott in favor.
Jennings in favor.
Bell in favor.
And opposed? And the amendment is adopted. Thank you very much. And go ahead, Trustee Campbell.
So at this point, thank you, Mr. Chair, and thank you, everyone. I just have some questions, a couple of which I think simply admitted relatively quick and easy answers, a couple of which I'll probably, depending on the answer, need to reflect on between now and board, but we'll see. So the first is in 215, the word violence is used or referenced 3 times. And in my experience, the use of the term can vary considerably as between individuals. And I find it actually an ambiguous term if it's not qualified by physical or mental or something else. And so I guess I just like perhaps a bit of an understanding from staff what they mean in this context by violence, and whether if they mean something more specific, that maybe a qualifying term is required here. I just like a comment.
Through you, Mr. Chair. So we also use the term violence later on when we discuss the rights of a child and the right to be free from discipline that involves violence. So I had a look at some writings by the committee that sort of looks at the Convention on the Rights of the Child and interprets what violence means. And essentially the standards under the convention is that all forms of violence against children are prohibited. So when we're talking about violence, it's not just physical violence, but it's also mental violence. And then it specifically gets to prohibitions against cruel, inhuman, and degrading treatment and punishment. So I think we're really talking about all forms of violence. So
it's a broad understanding, and that's very
it's a broad
helpful.
Understanding, yeah.
Okay, because I think that some people might interpret that as physical violence only, just because of their experience or what have you. So I do wonder, just perhaps staff want to take an advisement, including a glossary item on that, just to make sure it's clear to all readers, actually the broad scope of the use of the term that's intended. That was all. Is it okay for me to complain, Mr. Chair, that my clock is not advancing? Oh, there we go. So I guess I have a general question I'll have to put on the list again. I'll try and fit this question in before my time expires. And that is a jurisdictional intersex with respect to especially third parties and permit holders, and what scope we see that we have, whether we're going to have to introduce new language into contracts. I'll probably have to pick it up in a second round, but maybe I could get a start to an answer. Thank you.
And I may ask the director to direct that through you, Mr. Chair, to the appropriate person.
Thank you. So Trustee Campbell, I didn't understand your question. I know that the clock has stopped, but if with the indulgence of the chair, given that you asked the question before the clock stopped, could you clarify? Because I really wasn't clear on the question.
So in a sense, thank you. So when I put together the scope, it applies to all members of the OCDSB community, which includes permit holders and service providers explicitly. That's in part of the definition in one of the 2.6 something clauses, but defining the OCSB community that applies to. This policy applies to them all, including, and then refers as well to the OCD, it defines the OCSB environment, which includes anything transpiring on buses. So for instance, I guess the question I ask myself is what jurisdictional scope or intersect we're seeing, I don't know, vis-a-vis OSTA, vis-a-vis third-party daycares, vis-a-vis CUS permit holders, and what is our presumed scope of jurisdiction, ability to investigate, ability to compel. I mean, I don't know, do things have to be written into contracts? So I was just sort of wondering how that's going to work.
Okay, thank you. Okay, I understand the question a little better. I apologize for having to have it repeated. So it is there is a lot of complexity to that piece, and in terms of the capacity to compel, I think almost becomes central to that question, because certainly we can anyone who interacts with our students and our school community certainly is subject to whether it's a part of an investigation, conversation, or follow-up. The question is our capacity to compel change and difference. Certainly when it comes to the centering our students, there are certain jurisdictions we have around access. So that becomes a part of the question. In terms of imposing remedy, however, that becomes a different question depending on the role played. I do see that Superintendent McCoy has opened her camera. Usually that's a signal, but I think that again, some of this would be reflected in the procedure that unfolds out of this. And so that high level piece, that what we're saying is that anyone who has intersection with essentially our students is subject to the expectation that the human rights of every one of our children is maintained. I will ask Superintendent McCoy to just elaborate, because I believe you've been a part of some of this conversation as well.
Thank you, Director, and through you, Chair. So I think we could look at some analogous policies. So for example, our respectful workplace policy goes to our obligation to provide our employees with a respectful workplace, and that would include any interactions that they might have, for example, with third parties. So we have an obligation to protect in the same way the human rights of our students and our staff when it comes to their interactions with others. So that would include, for example, service providers or others who are coming into our spaces, or who our staff, for example, are interacting with in the course of their responsibilities and duties. So to that extent, it's not unlike some of the other policies that we already have in place in terms of looking at some of our obligations. I think some of the other pieces, and I think Trustee Campbell, you referenced this, is similarly with regard to some of our other obligations when we enter into, whether it's contracts or other obligations with third parties, we can embed language into those contracts, for example, which set out expectations in terms of how we expect them to behave. So for example, when it comes to some of our some of the legislation that's already in place, we ensure that we are embedding those obligations similarly into our contracts, so that our service providers are committing to adhere to certain things as well as part of the relationship that they're entering into with us. So there are ways that we can do it. I think there would be some jurisdictional limits, as the director indicated, in terms of our ability to compel in some cases. But I think it goes again to where do we, as an organization, our staff and our students, intersect with the third parties, and what is the nature of that relationship, where we can assert our expectation around ensuring that that they are not running afoul of the Human Rights Code or other human rights legislation or policies in terms of those interactions.
Okay, thank you. And if you could put me back on the list, please.
I certainly will. And we're going on to Trustee Schwartz.
Thank you, Mr. Chair. And given the late hour, I hate to do this, but I think we've got a whole lot of other stuff on our agenda, and it's already almost the 10:30 for our 10:30 vote. So I'm just wondering if we might want to entertain deferring this item to one of the next meetings. I see that there's a lot of additional speakers. We have additional, a couple speakers have already said that they have further questions and they want to engage further on this. I think in order to do justice to such an important policy, we really ought to defer this to a meeting when it's a little earlier in the evening, when we can actually have a more fulsome conversation.
So,
So
Schwartz, are you moving to defer to a future date?
I am moving to defer and have the agenda planning committee look at when to bring this back onto the agenda, and preferably first thing on the agenda.
All right, so I'm just going to consult Executive Officer Giroux to refresh my memory on a deferral motion. Debatable as to, is it debatable as to time and place, or if you could help?
That's correct, but I think it's actually a motion to refer to agenda planning schedule at a subsequent meeting.
Okay, that's fine. And I really do hate to do that, as I've been listening with very intently to Ms. Tanner, but given the late hour, I don't think we can do justice to an important policy like this.
All right, so Trustee Schwartz has moved that we refer this to agenda planning so that we can schedule for a more fulsome discussion. Is this executive officer? Is this subject to debate?
Debatable and amendable only with respect to the place and conditions of referral.
Okay, so with that, Trustee Scott, did you have?
Thank you, Mr. Chair. As we've been going along, I had been thinking along similar lines, wondering whether it would be better to refer to defer or to try something else. And if I may, through you, I would have a question for staff. And that is to the director and Ms. Giroux and Ms. Guthrie, whoever has the answer. But we had been planning for trustee professional development session on the 18th of January. As of the beginning of this week, we had not yet been able to settle the speaker for that. And if we do not have a speaker for that, would it potentially be better simply to adjourn this meeting and continue it on the 18th of January, pick up basically where we've left off? So the question is, are we solid for that professional development session, or is that one still up in the air?
Through you, Chair, I can answer the question about the professional development, and no, that was coming forward tomorrow for agenda planning. We had word this morning that we were not able to secure the speaker that was desired for that particular day. It is another date that is being proposed, and so therefore that engagement would not be happening. So that I can answer solidly, and I believe that Executive Officer Giroux has commentary on the other part of your suggestion, Chair Scott. So I'll turn it to Executive Officer.
So the manager of board service and I were investigating that while the committee was deliberating. The only caution I have on that is we don't know yet what the government's announcement is tomorrow. And that leaves us with schools scheduled to potentially reopen or not. So on that basis, I was more inclined to Trustee Schwartz's approach, which was leave it to agenda planning when we will know what that looks like and have a better sense of what that will mean in terms of the work associated, because there may, as we well know, be lots of other things that come with that announcement tomorrow.
Thank you for that answer. That makes a lot of sense. However, if it is referred to agenda planning, could it be referred to set it up as a continuation meeting? to make sure that we could pick up first with this and then just keep right on going to complete the remainder of the agenda.
Be a referral to continue this meeting at a date and time to be determined by Agenda Planning Committee.
Well, it sounds like the answer is yes.
Thank you for that.
Did you have something to add, Trustee Lyra?
I would rather not put off the other parts of this meeting until a later date. I think
Yeah.
we have the ability
That
to.
was the purpose. That was the purpose
Yes.
of suggesting we defer this item.
Mhm.
Perhaps we could defer this item for continuation.
I would
Yes.
love.
So
I would love to have a meeting with just this item on the agenda. Like, I think this deserves a good couple of hours of work by all of us. And so
With fresh minds is what I would add, because I think it's 10:30. I like many of you, it's been a long day, and I apologize to the speakers right after me from our committees, but I just think to do justice, it's important we do this properly.
all right, so and we will discuss the merits of the continuation meeting as opposed to having this as a single item. Trustee Lyra, if that's okay. Anyone else want to debate the referral? All right, so we have a motion to.
Mr. Chair,
Trustee Blackburn?
if I may, it's, I believe Trustee Bell brought up the idea that under new business, we would get the chair to write a letter about our concerns about the return to school. So I think I agree with Trustee Schwartz. We should just do the rest of the agenda and then quickly agree that our very capable chair could write a letter. I don't think we need to debate that. She heard everything that we had to say, and I trust her judgment in putting together a letter.
But the idea of a letter that Trustee Bell's motion put forward is in itself subject to debate, amendment, and I would imagine that it's not a 100% friendly. So,
Well, I would think it is. But I could be wrong.
Trustee Scott?
Yes, Mr. Chair. I mean, you can't do a motion without notice on a new substantive issue, but certainly the general content of the letter that was suggested was already provided by Trustee Bell when she spoke previously. She has subsequently circulated in the chat some additional suggestions for what could go in it. And I had indicated previously that I would have no problem with writing such a letter. So I don't know if we need to discuss it or if we can simply go on what has already been indicated and get that out quickly rather than waiting to do things. But we do also have a discussion item on the agenda tonight. You know, again, at this late hour, I doubt very much that we would be doing justice to that discussion item, which is one that trustees specifically had requested as well.
Yeah.
So I'm not sure at all, and we are already at 10:30.
I'm just wondering if we could maybe pass maybe suggestion here, since I'm still on the speaker side. Suggestion is that we refer this item as well as the matter for discussion to the Agenda Planning Committee for consideration for to determine a future meeting date. And then we can go through the rest of the agenda, which would include the letter if we need to. And I think we can get through the reports from committees quite quickly, as well as.
All right, so the motion to refer is the two items, item 7.2 and item 9.1, the matter for discussion. So, and seeing Seeing everyone here. Trustee Lyra?
10.1.
Sorry, I thought we were voting.
Sorry, it's 10.1 on the e-scribe, right?
All
So-
of item 9 and all of item 10, that covers the whole works.
Perfect.
So we're referring item 8.2 on the e-scribe
And item 10,
and item 10,
not item 9.
not item 9. Okay, so that is what we're referring to agenda planning. So all those in favor of the referral?
Bell in favor.
Blackburn in favor.
Boothby in favor.
Lyra
Schwartz in favor.
Huff in favor.
Campbell in favor.
Jenkins in favor.
Scott in favor.
And opposed? And that passes. So with that, we're going to move on in our agenda to item
Mr. Chair, do we still need to take the 10:30 vote?
we do need to take the 10:30 vote. That's right. So we need 2/3 of the trustees to agree to continue past 10:30. So all those in favor of continuing past 10:30?
Bell in favor.
Campbell in favor.
Lyra in favor.
Blackburn in favor.
Schwartz in favor.
Scott in favor.
Jenkins in favor.
Huff in favor.
Boothby in favor.
And opposed? And that passes. So let's continue on with the agenda. So item 9.1, Indigenous Education Advisory Council minutes. I'd like to call for a mover to receive the report from the IAC meeting of November 18th, 2021. Trustee Huff, thank you very much. Any errors or omissions to that report? Seeing none, I'll call a question on that. All those in favor? And opposed? And that passes. Thank you very much. Moving on, I'd like to call for a mover to receive the Advisory Committee on Equity Report of November 25th, 2021. Trustee Lyra, thank you very much. And any changes, sorry, any errors or omissions to that report? Seeing none, I'd like to call a question on that report. All those in favor? And opposed? And thank you very much. That passes. I'd like to call for a mover to receive the SEAC report of December 8th, 2021. Trustee Boothby, thank you very much. Are there any errors and or omissions? And seeing none, I'd like to call the question to receive the report. All those in favor? And opposed? And finally, I'd like to call for a mover to receive the SEAC report of December 8th, 2021. Trustee Lyra? Any errors or omissions? And seeing none, I'd like to call a question on that. All those in favor? And opposed? And that passes. Thank you. Moving on to information items, report from OPSPA.
Hi, Chair. The only, there is no OPSPA report tonight. The only thing that I'll remind trustees of is that the deadline for any resolutions for the AGM is the beginning of April. So if trustees have are thinking of resolutions to put forward, they need to come to committee no later than the March committee of the whole meeting. Trustee Penny and I this year are fresh out of ideas, so we're looking for others to come forward if they have ideas for resolutions. Thanks.
Thank you very much. And new ministry initiatives update, Madam Director.
Thank you through you, Chair. It would be incorrect to say no new initiatives because we are continually receiving new information about much of our COVID protocols and so forth. So suffice it to say that as we receive updates, we continue to inform trustees and our public through our updates to employees, to students, and to families. Typically on Thursday or Friday. So tomorrow there will be an announcement and we're unsure as to what directions will come forward there.
Any questions from the director, for the director on that? And seeing none, moving on, OSTA update. Trustee Jenkins, any update from OSTA?
Well, that would be from
Trustee Blackburn, sorry.
Yeah.
No?
No, Mr. Chair, there's no update.
Thank you, Trustee Blackburn. Sorry about that. And finally, on a new business. Any new business? Trustee Bell?
Thank you. And through you, Chair, I would like to put an urgent motion on the table for hopefully non-consent of voting. If Nicole could bring forth the components of the letter that I have proposed that the board write to the Minister of Education requesting that certain measures be implemented as soon as possible to increase the safety of our schools for students and staff. I would like to say that the urgent nature not only is because schools are starting soon, there are a number of other boards I know throughout the province that are also moving forward similar motions. And I believe that there is power in voices being raised together. And there are various components of what this letter could include, and I'm open to voting on them separately if need be, but a lot of them are very, very straightforward. And as my colleague Rob Campbell has often insisted in the past, if we are to move it with softened language to request that the minister consider these facts, I would be fine with that passing as well. That's my introduction for now. Thanks.
Thank you very much, Trustee Bell. And we do have a staff comment from Executive Officer Drew.
Sorry, Mr. Chair, as the chair of the board mentioned earlier, adding the motion itself is adding a substantive item to the agenda. It might be easier to have a discussion around the content of the motion as it would inform the content of a letter, as the chair has indicated a willingness to send the letter. And we have lots of examples in the past where we didn't actually need a motion to send a letter. So it would be simpler to just have a conversation and not get into the procedural issues associated with whether or not we can add it, et cetera, et cetera.
Okay, so are you okay with that, Trustee Bell, that it's a discussion, given that the sort of the consensual nature of the chair to write such a letter?
Yes.
Okay, thank you very much. And Trustee Lyra, go ahead.
I am going to reiterate the point that I bring up, I think every time we write a letter to the minister, that we should be using firm language. We should be asking the minister to do something, not asking the minister to consider it. And I think that if we are taking the time to write letters, we should be asking the minister to reimburse the schools for all pandemic costs, because I don't think asking them to consider it and then having them be like, yes, we've considered it, no, we're not going to, is what we want. We want them to do it. So we should reward our teachers to do it. Thanks.
Thank you very much. And we do have the essence of the points that raised by Trustee Bell on the screen, and Trustee Campbell, go ahead.
Thank you. So I generally support this. And in this case, I don't actually, I'm not actually looking for a consider clause. I think that previously, the difference being that previously we were talking about a piece of effective legislation, the ISPA or whatever it's called, with respect to communicable diseases, and whether or not to list something there is effectively a medical decision. It's epidemiological decision. And so I balked at positioning ourselves as epidemiological or medical experts. In this case, I consider this different. These are general aids that are well recognized against a COVID spread. I personally don't care about the consider word in this case. There is a distinction. Thanks.
Thank you very much, Trustee Campbell. And we have Trustee Scott finally.
Thank you. I also don't see these items as being things that we should be asking the ministry to consider. These are things we basically just want. And so we can ask him to just provide them or do them or pay for them or whichever, but it can be very directive language.
Thank you very much. Any other trustees want to contribute to the discussion? Okay, so thank you very much for the discussion. And so Trustee Scott will, Chair Scott will write a letter to the minister with those points in mind. And I imagine that you will CC the letter to all the other trustees, right?
I will try to get a draft out probably by sometime fairly late tomorrow, and with a view to getting this out to the minister by Thursday.
Thank you very much. Are there any other items of new business? And seeing no other items of new business, we are adjourned. And I'll let everyone know as soon as we decide what we're going to do with the other two items. And a good proposal was on that Tuesday. So we'll let you know as soon as possible. And thank you very much, everyone, for your patience and your cooperation tonight. It was well worth it. Thank you.